have the group here that is the right group to talk about a lot of these things because a number of you have not only are working in healing areas with different kinds of populations, but you've had some experiences of paranormal kinds of experiences, and I will be trying to help you understand that in the context of the collective unconscious, the concept of the collective unconscious with Jung. And let me just say a few words about my own background and my work, so you can kind of get an orientation in where this workshop fits in the larger body of work that I've been pursuing for a long time now. And let me just say a little bit about that, and then I will giving you some theoretical background. We'll get into that a lot more deeply. But I am a psychoanalyst, and I'm one of the few suckers for punishment that has studied a lot of the different schools of thought in depth. You know, I'm a perpetual student, like I think some others are here today. And my first book was a Freudian book. My first psychoanalytic diploma was an Adlerian psychoanalytic diploma. I then, my Jungian friends say, saw the light, and came to the Jungian Institute of Chicago to study Jungian analysis. I have been interested in depth psychology and the universe for many years. And so I have pursued this journey of study of Jung in relationship to philosophy and religion and the human sciences ever since 1965. Now, the older I get, when I say that and I think about how long that is, it's terrifying. But anyway, I've never lost interest. I've never regretted it, and I never get bored with this stuff. And so I want to say thank you to all of you for coming here today and giving me an opportunity to think with you about these things that are important to me, and I think you'll see to a lot of persons. So I'm professor of psychoanalysis, psychology, psychoanalysis, and spirituality at the Graduate School of the Chicago Theological Seminary in Hyde Park, where I teach comparative psychoanalytic theories in relationship to ritual process and human spirituality to rabbis, priests, and clergy, and other folks that are crazy enough to study such things. And I teach here at the Jung Institute when I have the time, and I now have been spending a lot of time trying to work on my own integration of different psychologists and psychoanalytic theories, which is clearly an attempt to extend Jung's work in the contemporary context. But I call my work structural psychoanalysis and integrative psychotherapy, because I'm trying to get a lot more clear and specific about structures of the psyche. One of the things that we'll see in a little bit that I feel is that a lot of folks turn away from Jung's fundamental vision of trying to decode the structures of collective unconscious. And my interest in this class as a part of that in the clinical context is for us to try to carry his work forward in a scientific way and not make it into a Jung cult. You may have seen this book, The Jung Cult, that came out not long ago. It's very easy for any psychoanalytic school of thought to become cultic. And you see that actually the traditions of psychoanalysis have and of different psychologies as well, have a tremendous temptation. They're very seductive to seduce people into very, very tribal, cultic attitudes in which if you're not a cognitive therapist, you're stupid. Or if you're not a behavioral therapist, you're an idiot. Or if you're not a Freudian, you're crazy. You know, and this is just eating up psychology. It tends to be something the human mind does. And I think we'll see some this weekend about why tribalism in religion and tribalism in psychology is so attractive. Because I think once you get a feeling for how frightening it is to try to contain all the things that are in our psyche, why we cling so rigidly, compulsively, why we are so compulsive in clinging to our religious theories or our psychological theories rather than being open to new data. There's a lot of recent brain research that I hope you'll remind me to comment on tomorrow that helps us to understand that there really is a neurophysiology behind this tendency to be rigid. So what I'm going to propose to do right now is just give you an outline of the 2 days so that you'll see kind of what we're going to do first and where we're going. And then as soon as I do that, we will jump in and we'll take a break at 11:15 and for 15 minutes so you can stretch. And then we'll come back and we'll go to 12:30 sharp. We'll take a break from 12:30 to 1:30 for lunch. And then we will, I'll try to end and get you out at 4 o'clock sharp so you can do your thing for the weekend. So let me just run through this. The first thing I want to do is to give a very brief introduction to this specific topic, archetype, compulsion, and healing, and why I think that's so important. And then I want to give you some background before our break this morning. This is going to be a lot. We're going to go fast. But to give you a sense, I really am glad that a number of you, in fact, I suspect all of you have some interest in human spiritual traditions and the way they relate to the psyche, because I want to help you see the thread that goes through human spiritual experience and religious experience to what we're talking about today, which anticipated the development of dynamic psychology and depth psychology. I want to just briefly talk about that, give you some resources to read on that, to flesh that out later. And then I will turn to, I'm going to put this in the context of the experience of what I call in my work the great self, what Jung called the archetypal self. But I'm going to talk about the great self as it has manifested in human spiritual experience. And then I'm going to talk about the great self as it has been imaged in psychodynamic theories prior to Jung. And then we're going to take a break. And I'm going to talk about the strengths and weaknesses, briefly, of Freudian treatments of the great self. Freud's treatments, that is, not Freudian, because we'll get to some more of those later. And then Adler's treatment of the great self. And then we'll take a break, and then I'll come back and I'll talk about Jung's treatment of the great self. Kohut, briefly, I'll keep it brief for those of you that have had, for those of you that have had Kohut coming out your ears, and then my work on the great self before lunch. Just a very brief intro before lunch. And then when we come back from lunch at 1:30, I will give a brief summary of what I believe is the structural coding of the great self, which is behind, which I think you need to understand if you're going to understand how subtle and pervasive compulsivity is in human personality. What I'm going to tell you today and tomorrow, essentially clinically, is that all psychopathology is compulsive. That is to say, the people that don't have much depth in their theoretical grasp of the psyche, they will make obsessive compulsive phenomenology one thing, and they'll talk about compulsive personality disorder. But what I want you to get this weekend is that all psychopathology is compulsive. And it's compulsive in a much more subtle way than most theoreticians understand. And what I want you to get a feeling for clinically as helpers and in your own life, we might as well benefit from thinking about it. I'll share a little with you about my compulsivity so that you can see, I'll use myself a little bit as a case illustration. And you can think about yourself as a case illustration. But the point being that I want you, before you go away tomorrow, to have a feeling for what we might call the varieties of compulsive experience and the various shapes of compulsivity, because it is more highly structured than most theorists understand. It's much more structured. You can understand it a lot cleaner and a lot better, and you you can get a sense about where the weaknesses in your own psychological structurization are, so that, or your patients, you can get a better, clearer picture about where their compulsivity is leaking through as a healthy structures of their self. In other words, I want you to get a feeling for the enormous difficulty we as a species are having controlling our compulsivity. We're flunking this. The reason we're eating this planet, the reason we're destroying the ecosphere, is really grounded on our inability now to control our compulsivity. And I want to tell you tomorrow, in terms of interventions and the radical shifts in our way of thinking about therapeutic interventions, tomorrow, we've got to strategize a much more effective way of helping people to contain their compulsivity. And we're doing terrible on this. And we are moving into an extremely dangerous period where the traditional vessels of containment of compulsivity are falling away all over the planet. And we're getting much more compulsive behavior in terms of compulsive violence, as you're seeing with these school shootings. And I want you to understand the relationship between our blindness on the power of compulsivity and what's happening to us on this planet and in our cities and so on. So it's a lot of stuff, but I think I can give you enough of an outline and some sources that you will be able to continue your work on your own. I will this afternoon. I'll just give you that diamond body structure that I believe is the code for understanding these different forms of compulsivity. And after the break in the afternoon, I will talk about that diamond body code in relationship to the different forms of compulsivity and fragmentation. So, in other words, by the end of the day today, I want you to have a sense of the geography of the great self and the way in which it helps us understand the power of fragmenting processes in the psyche. Why are we so prone to fragmentation? And how do we typically fragment? Tomorrow morning, I will want us to focus more tightly in on clinical vignettes. And for you clinicians, if you have a dream that is either yours or of one of your patients, you can turn off the tape when we go into those materials. And if you think that you've got a dream that indicates some compulsivity, some compulsion, then you can bring that in, and I will be able to comment with you on that. We'll look at that sort of thing, and I will share some dreams that illustrate what we're talking about. And then after the break tomorrow, we will focus on strategies in integrative psychotherapy. And what I will do there is to try to help you understand how our very profession, healer professions, particularly the mental health professions, I'm going to describe the shadow of them in terms of their own compulsivity. In other words, the pathology of the therapies. And then I'm going to talk about what I feel we need to do in order to get a lot more effective in helping people cope with this enormous flooding from within the psyche. So that's what I'm supposed to do in the order in which I'm supposed to do it. Now, is there anything, I mean, that's a lot, but is there anything else that you want to ask me to do in the course of the time we have together? Anything else you want me specifically to address other than this? You can tell me at the break if you like. So let's get started. And let me just say, before tomorrow, you can give some thought on what vignette or dream that you feel you can ethically bring before us. And if you can write the dream down and then make some Xerox copies of it before you come tomorrow, so that we can share it. Bring about a dozen copies, and then you can collect those after we look at them, so preserve confidentiality. All right. Now let me just begin by saying this. The reason I chose this topic is this workshop is part of a series of workshops I've been giving. I've been trying to produce a body of work for clinicians and other folks who have responsibilities in spiritual direction or spiritual leadership in various sectors to help them bring order into the enormous cacophony of voices that they have to contend with in terms of psychological and clinical things. And I've been trying to focus on giving a commentary on the structure of psychopathology if you have a Jungian or neo-Jungian framework. And so I've been working on laying out my understanding of the collective unconscious structures, how that relates to Milan's theory of psychopathology that you may have studied, and if you haven't studied, I recommend that you do, because my fundamental assumption here is that this is not, that psychopathology is not chaotic, it is shaped. There is a shaped psychopathology. And if you get a grasp of the structures of the collective unconscious, you can begin to bring order into the geography of psychopathology and see that it's not just random, and see that, in fact, my argument is that psychopathology is really not personal. Most schools of psychotherapy think that the most important thing about studying psychology is to learn about personal learning patterns or personal cognitive patterns or personal unconscious patterns if they're dynamic psychologies. My theory is in order to have an understanding of the psyche, which is not a pathology of the psyche, you have to understand what the codes are for the development of a mature, fully functioning self, and then think about the way in which formation through human development, and deformation of what is a enormously wonderful potential, how that deformation occurs. And so what I've been trying to do is to lay out a view of how we can understand the structure of the psyche, so that we can have a sense of what is going wrong in terms of these maps from the collective unconscious when they are not brought in any kind of balanced or integrated way. And so that's been my project with a capital P. You know, when you're studying any thinker, you need to ask, well, what is their capital P project that is behind any of their specific projects? And so this particular course is focusing on something that I have come more and more over the past 2 years even to realize as a analyst and therapist and leader, that compulsivity is far more important than I ever understood before. And that if we really get a sense for the enormous furnace in the human psyche, the enormous powerful generators in the human psyche, that then you can begin to get a sense of what psychic energy is. I mean, what this energy is that humans have such a terrible time regulating. And so that led me to want to talk with you about this topic today. Archetype, the psychological generator, 220,000 volts in there. And compulsivity, what happens to a person when they don't have the transformers they need to get that down to 110 volts so they can plug something into it and make coffee or run a air conditioner or whatever. And healing, what can we say about practical ways to help people get into the zone of functioning which enables them to plug into that psychological energy so that they don't gray out and become depressed, but not plug into it in such a naive way or unconscious way that they become manicky, that is flooded with the energy. So that's the territory that I'm going to be working with you on today. Now, I said that I wanted to start off by talking about sort of phenomenologies of the great self that we see in religious and spiritual traditions. The reason I want to do that is simply to say, make clear that recent psychoanalysis, even from Jung on, has really felt that they are original in getting at narcissistic dynamics, the dynamics of grandiosity. In fact, human spiritual traditions have always been aware of the enormous power of the thing in the human psyche and in human community. And I can only recommend that you, let me give you one book that will give you a competent overview of a lot of this material. It's by one of my former graduate students, doctoral students, Michael Smith. And he wrote a book and published it some time ago, entitled Psychotherapy and the Sacred. Psychotherapy and the Sacred. It won the Knapp Book Award for psychoanalysis a couple years ago. And I recommend that you look at that because he gives a lot more in-depth treatment of the things I'm just going to allude to now. But if you think about it, you could name a lot of traditions in which humans are aware of the huge energies that are around the human community. And let me just start by talking about indigenous tribal religions. You know, the early anthropologists were very arrogant, Eurocentric, so-called Christians, and they did not have much empathy for the phenomenology they were observing, and they tended to pathologize it and to be contemptuous of indigenous tribal traditions. They wrote off a lot of very powerful indigenous tribal insights under the title of dynamism. And how many of you have ever heard of the theory of religion called dynamism? Raise your hand. Yeah, you have. This is the theory that there's an impersonal force. This is what the early anthropologists saw in their observations, and they called it dynamism, meaning that the human view in certain human tribal spiritual traditions that human community is surrounded and permeated by an impersonal force. Our latest version of that is Star Wars, of course, the Force. I'm not kidding. They're picking up in those series of movies, they're picking up on some of these primary phenomenology of religion ideas. And the idea of the Force is a reflection of what used to be talked about as dynamism. And the Native American, certain Native American traditions and many other indigenous tribal traditions had this idea of a power, mana, or orenda. They called it different names in different tribal traditions, but they were very aware of an extremely powerful energy permeating their environment, both inner and outer environments, that was dangerous. They were very clear that it was dangerous. You cannot understand indigenous tribal people's views of taboo if you don't understand this issue of the dangerous energy that is around. And their interest in ritual process, which we'll get back to, we'll loop back to the importance of ritual. They knew that you needed to have sophisticated ritual processes in order to protect humans from this impersonal energy. And the idea of that impersonal energy was an idea that in our terms today was a lot like radiation, atomic radiation. So it's very interesting to study indigenous tribal religions and understand that our fears about Chernobyl are very parallel to their everyday fears as spiritual persons, because they were very aware that there's a force in human life and around human life that that you do not want to relate to without care. Because if you're disrespectful to it, it's not that in those views that it's evil, and this is uncanny, because as we get later on today into what we know about grandiose exhibitionistic libido today, it is very, very similar to what these early tribal peoples felt about this impersonal energy. That is, it is dangerous. You got to relate to it carefully. You got to be extremely respectful. You need ritual processes to relate to it in a relatively safe way, although you can never be totally safe. And it is contagious. And if you get it on you, it may kill you. And the worst news, that's bad news, but let me tell you the worst news from that point of view, and also from what I'm going to be saying to you as we go. Listen with your therapeutic ear, because what I'm saying to you is the insights of these indigenous tribal peoples about this energy are parallel to what I'm talking about in terms of the grandiose energies of the self that are still with us and have not gone away. In fact, we are more vulnerable to them today than the tribal peoples ever were. So anyway, there's another source you can look at. The great French philosopher Paul Ricoeur, R-I-C-O-E-U-R, did a book called Symbolisms of Evil. And in that book, there's a section on defilement. And it is a phenomenology of these human experiences of getting it on them, getting the taboo energy on you. And as I say, the bad news is that this can get on you and cause you to be destroyed personally. The worst news is that when it gets on you, you contaminate other people and your community and the world. And so from the indigenous tribal human point of view, which if you don't know much about, you need to read Mircea Eliade's books on the sacred and the profane and his other work. It really can destroy the world. In other words, that in these mythic traditions, they all have a sense of the world as it is. It should be optimally organized. In the Jewish tradition, shalom. You know, in the ancient Egyptian traditions, mat, the right order. The world should be ordered. And they all have a very similar thing, this fantasy of justice and peace. Justice and peace, right order. And all these mythic traditions, and I've lectured in my lectures here at the Jung Institute, and all those lectures are available on creation mythology and the structures of the self. All of these mythical traditions about this stuff I've lectured on, and that stuff's available through the Institute if you're interested in pursuing that. But the point being that these energies, if not related to carefully, not only destroy you, they destroy your community, family community, and your cosmos. That is, cosmos is destroyed and it is replaced by chaos. There is a book by Kohn. I can't remember whether it's with an E or just an N, C-O-H-N, but it's entitled Cosmos and Chaos. I'm not sure that's exactly right. I'll try to look at my book and make sure that's right. But anyway, it's a study of human mythology about this issue of cosmic world, right world, and then chaos. And what you should be aware of is that these dynamics with regard to archetype, compulsion, and fragmentation were anticipated in the myths of these indigenous peoples. So that is one tremendous source of study for you to get a sense of the history, of the early history of insights with regard to powerful energies which may not be evil in themselves, but which if you relate to in a disrespectful way will destroy you. And those of you who studied any biblical resources, you remember the story about when the Ark of the Covenant of the Hebrew people was being moved. And one of the people carrying it, trying to be helpful, it started to slip, and this individual reached up and steadied it keep it from falling, and he died. He was killed. And Bible scholars and theologians have always tried to make sense out of that. What in the world is that? This man, I mean, he was trying to help, and he was killed by God. You know, why did this have to happen? And that story is an illustration of these ancient traditions, that there are energies which you've got to be real careful relating to, and it doesn't matter if you mean well. It doesn't matter if you're on a spiritual quest and you relate to these energies. They'll kill you if you're not careful. And this is an insight that Jung had and has been lost by a lot of contemporary Jungians, and that is that the archetypal self and the great energies of the unconscious are not, you can't assume they're friendly. You've got to be careful when you're dealing with your inner work. Yes. Remind me to talk about the work of Edward Edinger. Yeah. Right. Edinger's work is important for what we'll be talking about, and I'll try to refer to that later this morning, because the work of Edward Edinger is very important for you to study to get a feeling for the sort of classical Jungian position on this material. And I'll come back to that. But let me finish talking about these briefly about these religious traditions. So those indigenous traditions. Then you've got the Judeo-Christian tradition, and that would be one example of this that we just spoke about the Ark of the Covenant. But Jewish and Christian traditions, including mystical traditions, which some of you have studied, are replete with all sorts of images of getting in touch with a great self within. And of course, one very obvious example of this is St. Paul's experience on the road to Damascus, which was been named as his conversion experience. But in this context in which we're talking about, it is an understanding that there are realities which, if you encounter them, you call them spiritual realities or psychological realities. Jung thought that they were archetypal realities, whatever else they were. If you encounter them, they will destroy your old ego. And they call that Paul's conversion. Saul of Tarsus no longer lived, and then there was Paul. But what I want to say to you is that all the traditional studies of conversion experiences in the psychology of religion are related to this issue of the great self within. That is to say, when you connect these archetypal dimensions of the psyche, it is going to be a trauma to your existing ego structures. And one of the reasons, when I was a young scholar and a young student of all this stuff, there was an enormous amount of pathologizing of religious experience that went on among mental health professionals, and even among pastoral counselors, and even among hospital chaplains, who you would think would be trying to get people to use religious resources to deal with their illness or so forth. But they were emphasizing, quite rightly in my view, the idea that spiritual practice is not safe. And getting into the depths of the human psyche is not safe, because there are things in there that are loaded with energies that are very difficult for humans to regulate. And I keep using that word regulation, and I mean to do that because that's a basic theme for us today, clinically, as clinicians. That is, we need to understand that all of our patients and all of us are struggling mightily with the task of regulating forces within the psyche, which are extremely unruly, which are extremely impersonal, and which are not moving toward integration. Once you get clear that, I would argue that I would be arguing this, the longer I study all this stuff, the clearer I am that the task of all therapy, healing, and spiritual direction is to help people with the enormous challenge of regulation of their personality dynamics. Regulation, meaning it is not to get you to any kind of place where you can be called healed, because that is a static concept. People are in an energy flow pattern, and that is very variable during the life cycle, and it's variable according to what kind of traumas are happening to you in your life journey. And so the challenge of adequate regulation of psychic energy and psychological functioning is a moving target, and always is and always will be. And that's why the idea of getting somebody healed in therapy is really ridiculous. You never get anybody healed. You can only help them learn to regulate. And you have to give them tools which they can use to regulate the incredible dynamic process that is their personality as it goes through time. And once you begin to understand that, then you can understand the importance of the teaching function of the therapist. So many therapists, and we'll get into this more later, and please remind me to talk about this, so many therapists that don't understand this, they create a pathological dependency in their clients or analysans, in which the client or the analysand is encouraged to continue using the therapist or analyst as a self-object function, and they continue to do things which keep the transference in a very dependent modality. And we get very long therapeutic processes that don't heal people. They make a lot of money for the therapist if the therapist is in a certain niche, but they don't change the structure of the personality. And so what we'll be seeing tomorrow is there is a mentoring function of the therapist or the analyst with the goal toward helping the person learn resources and interventions for creating an ongoing capacity for self-regulation. This is true whether it's an addiction, whether it's a personality disorder, whether it's a borderline personality disorder, whether it's a person that has had difficulties with psychotic episodes. That is, say, the fundamental task of our work as therapists and spiritual directors and healers, whatever, is to mentor persons into the capacity for regulation. These are issues for all of us in various degrees. And it's very important for us as we look at very disorganized people to understand that there go I if I had fewer resources for regulation, and not get into this nice little us-them fantasy that is encouraged by professional models of therapy. And tomorrow I'll be talking about, as I said, about the shadow of therapy. It is a defense. It's really a defense. So, yes, John, go ahead, and then I'm going to jump on into a few more religious illustrations. Yes.
What we've seen, archetypal and unconscious energy, is having a beneficial thing, even though you do have to keep them sort of regulated.
Yeah.
But you're saying they don't have any, that's not their main function or intent, and we have to kind of fool them? Or?
No. What I say is very important. One of the main things that I'm trying to communicate that is clinically relevant, and is if a therapist, especially somebody using Jungian frameworks, if the therapist is not clear about the enormity of the fragmenting power of archetypes, that they will be doing dangerous things to their clients and their the people they're trying to lead or help or work with, because it's archetypal energies are, if we just do it from a scientific, I'll try to say when I'm speaking from spiritual perspectives or things having to do with religious leadership, make a distinction, but when I'm speaking as a scientific psychoanalyst, which is the way I think about my work, I'm just saying these things are forces of nature, and they are not personal, and they are not friendly, and they have a purpose if you understand what they are for in terms of psychological functioning, and later we say in terms of spiritual, positive spiritual things. But the thing that is underemphasized by both spiritual leaders and by certainly by Jungians and by anybody that is aware of these archetypal energies is they are dangerous They're always dangerous. They never become not dangerous. It's important to understand that they are never human-sized, and they are always imperialistic, and they are always trying to force you into compulsions. Now, the distinction that I will be making as I go later today, you can think about the archetypal self in some ways, and I'll be showing you about this, how you can say that it does force certain kinds of regulations on us. But there is a romantic Jungian view that some folks have, I think representatives of the Jung cult, who think that the archetypal self is benign. And that if you have powerful archetypal dreams, this is extremely happy development in therapy. And that is a dangerous point of view, because Jung was clear. Jungians are not clear, many of them, but Jung was clear that the archetypal self is dangerous, and always dangerous, and that you relate to it with care and respect, and because if you do not, it will invade you. And so remind me if I get too excited about something, some rabbit that runs by and I chase off it, remind me to come back to the issue of the way the archetypal self regulates and the way it does not. But anyway, now let me finish this thing on religious experiences by addressing the phenomenology of yoga in various traditions. Practitioners, high-level practitioners of yoga in different traditions, not just Hinduism, but Buddhism, various forms of Buddhist yoga, are very aware of the primacy of energy, of spiritual energy, and what is often imaged in yogic traditions as fire. So there's a tremendous amount, and beyond yoga traditions, all this imagery of fire, like in Christianity, the fire at Pentecost, the fires, imagery of fire at Pentecost. In religious traditions, there's tremendous awareness of fire as a fundamental phenomenon, spiritual fire. All that fire imagery in all these traditions is related to what we're talking about this weekend. And specifically in yoga traditions, the yogi is seeking to plug in to this fire in a way that leads to spiritual enlightenment in various expressions, various forms. And these Kundalini traditions that you spoke of earlier are deeply related to this issue of this furnace within the psyche. The imagery of the snake in Kundalini traditions, the great serpent, is related to this thing we're talking about. The rising of the Kundalini can be described, that is one way of talking about the phenomenology of the emerging consciousness, of emerging awareness of this great self within. And so you need to think about the phenomenology of religion and spiritual experience in the context of these enormous generators in the psyche, and the various forms in which this thing in the psyche, when it's stimulated and wakes up and starts to we might say, depending on how friendly you're feeling toward it, starts to invade the ego, or starts to possess the ego, starts to displace the ego, or to fragment the ego. We just need to understand that there are huge, incredibly huge resources in the understanding of how this great self, or these great energies appear in human life in those spiritual traditions. And if you are Jungian in your method, if you follow Jung, as I try to in my approach to these things, when I look at those traditions, I don't look at them in terms of the route that tradition gives about that phenomenon. I look at it as psychodynamic expressions, that is, manifestations archetypal energies in the collective unconscious. And in my view, if we did Jung's work instead of getting sidetracked and not continuing the research, we would have people putting a lot of energy into mapping out and comparing these maps that tell us about the structures of the archetypal configurations of the psyche. That's what I try to do in my work, and it's too much for any one person. I mean, there are a lot of people that have got to work in this thing and compare their work and see it as not becoming a Hindu or becoming a Christian or becoming a whatever, but seeing it as increasing our understanding of the shape of the collective unconscious. Okay, I want to talk now about the great self in compulsion and fragmentation, according to early psychoanalytic reflection in Freud and Adler, and what I want to do this for is I try to say to people, look, that smart people in our history, whether they were shamans or whether they were early psychoanalysts or early researchers, they've seen pieces of these dynamics. And our tendency is to find something that a particular theory or a particular theorist or particular tradition didn't see and throw out all that tradition did see. And what I think we've got to do is to draw together insights from all these traditions and try to build on them, as Jung tried to do, for our waking up process to the species that we are. And, we got to be concerned about figuring this species out fast, because we don't have much time, I think, personally, to get it figured out and then try to figure some ways of trying to intervene in keeping our compulsive destructiveness from destroying the planet and the possibilities for life on it. And I'm deadly serious about that, and I don't have time to talk about it. I lecture on that and talk about that in lots of places and a lot of times. But let me start now with Freud. Well, let me just say, if you haven't read William James, if you haven't looked at his varieties of religious experience, look at William James's work, especially his varieties of religious experience, in which he gives some phenomenology of pre-Freudian, pre-psychoanalytic phenomenology of the subconscious mind and what was seen. It's amazing how much William James knew. William James was an enormous genius and needs to be studied more today than he is. But if you look at that book, Varieties of Religious Experience, it'll help you get some background on the just what appears in the human psyche that is not personal and intrudes into the consciousness of the person. James knew a lot about that. The other book is an old book which, just for some phenomenology, is by R.M. Buck, B-U-C-K-E, who was in my view, a really great Canadian psychiatrist around the turn of the century. And he was a friend and student of Walt Whitman, the great poet. And but he became interested in, partially I think because of his idealizing transference to Whitman, maybe his infatuation with Whitman. He became aware of what he called cosmic consciousness. And the book is called Cosmic Consciousness. And it contains some of that early Darwinist, sort of racist, Eurocentrically arrogant Darwinism in its attitude toward evolution. But the phenomenological description of awakening and illumination across human experience is just stunning in that book. And what I'm suggesting to you is all these phenomenologies of paranormal experience are related to this great self within that I'm talking about in the archetypal dimensions of the collective unconscious. So take a look at those two sources. Now, Freud is the great founder, the great genius that gave rise to contemporary psychoanalysis. He had an unerring eye. A lot of people have thrown out Freud, and that's really stupid. I mean, Freud was a great genius about a lot of things. And he had a sense that he had two ways of talking about the human struggle with these great energies. The first, of course, was with the it, as he called it, which got badly translated as the id. The it in the human personality, which is incredibly sociopathic and voracious in its appetites. As you all know, all of you in this room know, Freud really saw in all of us a tremendously voracious, what he felt was primitive aspect of the psyche, primary process aspects of the psyche, he called it. And in this was what we would say in the context of today, compulsive sexuality and compulsive aggression. The whole idea of eros and thanatos, and the way in which the human struggle, according to Freud, was to get to the point where the person's little space to live in as a human being through the development of the ego would be able to press back against these huge forces in the unconscious enough to get some living space. Freudian psychoanalysis and visions of healing are really about supporting the poor human being against enormous forces in the psyche, two of which are the id, the it that we're talking about, and the superego, as Freud formalized it. Now, I won't get into Freud's fantasies about how the superego formed. You've all studied it probably. But what I want to call attention to today is Freud had this unerring sense of how rocky it was for anybody to form an adequate ego, how difficult it was to form an adequate ego, because the power of the id was so huge in pressing the individual into antisocial activities. And if the individual, in his Victorian time, there was a very, very vertically integrated system of repression in society, which I want to point out today is crumbling. The vertically integrated systems of repression for society are now crumbling all around the planet. In other words, the integrated systems, however you feel about them, of culture around the planet, not just in Vienna or Chicago, there's enormous cross-cultural interdisciplinary evidence that the systems of what Freud would call repression and cultural suppression leading to the formation of superego structures, in his view, are collapsing. What is interesting about Freud, if you look at his phenomenology of the superego and his phenomenology of the id, if you look at it and you forget if you just put his metapsychological speculations aside and you just look at what he described, he is describing the grandiose energies of the psyche that we're talking about today. The way in which there are things in your psyche that will push you into unregulated aggression, and there are things in your psyche which will push you into unregulated eroticism, which he liked to call perversions, polymorphous perverse. And he noted that in more disorganized personalities that the two tend to go together. They tend to kind of meld in together. That is, the eroticism and the aggression tend to kind of melt into each other. So they're not adequately differentiated. And so you can understand Freud's thing that what we can hope for? Well, to Leben und Arbeiten, to love and to work. And a lot of people make fun of Freud about that. The truth is, Freud was right. If you look around you, and I am anticipating our discussions tomorrow, if you think about your life and you think about your struggle to regulate your affectional and erotic life, and your struggle to regulate your work, to be able to get your aggression in service of your work instead of having it push you into destructive either resistance to your aggression or flooding of your aggression, then you'll understand how brilliant Freud was in seeing this, and how the thing I love about Freud and classical Freudians is that they don't clean up things when they look at them. They're not sentimental. They will look at the ugly thing about the human psyche, and they will not prettify it. And we're getting away from that now, and we're losing touch with our awareness of just how dangerous a species we are. And we're rapidly getting to 1984. The methods of 1984 in that book, 1984. You know, the dominance of the drug companies now as a substitute for any kind of cultural vessels of regulation is incredible. We can talk more about that tomorrow. But anyway, what I'm pointing out to you is the superego. Look at the superego in Freud. There is this huge thing pressing you toward perfection. If it exists, if it is in your personality, and it's what he called a punitive superego. This thing in you that's not you, it's not your ego, or it's not your little s self, we might say today, but all of that pressure that you may experience toward being perfect is pressure by this huge thing, this Über-Ich, Freud called it, the over-I, the over-I, the huge thing that is over-I and is pressing me toward perfection relentlessly. You know, my life is a workaholic. I could write a book, My Life is a Workaholic, you know, and I really see clearly the truth of Freud's teachings on the punitive superego, because, you know, it's never enough, you know. And to the extent that you've got a superego in Freud's sense that is not really challenged by an ego development that takes the side of the human being in you, then you can think about your personal struggle to fight back against this great force. So in my view, Freud's understanding of both id and superego are really phenomenologies of the way the great self within pressures us human beings, and we can quibble with him about his understanding of the psychic apparatus, the plumbing, but he had an unerring eye for the reality of the human condition, and that is the way this thing presses us, and it's hard to push back against effectively. That is, why is it so hard if you're an addict, why is it so hard, even if you're in a 12-step program, why is it so hard to get to a place where you're not seduced back into flooding of addictive energies? And so Freud had brilliant insights that we tend to not appreciate enough about the frightening instability of our regulative processes. I don't have time today to go into that in great detail, but I want us to acknowledge him for seeing these huge pressures on the human person. And we just want to say that he was anticipating later developments in Kohut, Jung, Kohut, and the work we're talking about today, to flesh out this understanding of these huge forces and their implications. Adler really, I call these dynamic psychologies because I don't really think Adler's work is, even though I'm an Adlerian analyst, as well as a Jungian analyst, I don't consider that a depth psychology, because Adler really, much like James Hillman, truncates the understanding of the unconscious. There's no real sense of the plumbing of the unconscious in either Adler or Hillman, and I think Hillman's work is really, I've said to him and to a lot of people, it's really crypto-Adlerian. It's really basically an Adlerian view of the psyche, with a misuse of the word archetype, in my view. But anyway, Adler did see this phenomenology. And if you remember from your brief studies, probably in your graduate studies of Adler, he focused a lot on this inferiority complex. But what most people don't put enough emphasis on Adler said that behind every inferiority complex is a superiority complex, and that superiority complex has to be dealt with if the person is going to successfully change and grow out of their inferiority complex. And so Adler saw, think about this, superiority complex, that's an organization, the complex is an organization in the psyche, which has entitlement claims and superiority claims, which lure the individual away from effective involvement in their life. That is the Adlerian view. That is, so when you go to see an Adlerian analyst, they are going to try to help you find the areas in which your superiority complex is leading you not to really occupy your life. The way in which your entitlement claims and your preoccupation with your superiority in various subtle ways leads you into non-cooperative patterns and non-creative patterns in your life. And so I simply raise this to say that I think Adler's view of the plumbing was radically inferior. His capacities as a phenomenological psychologist were outstanding. He saw the ubiquity of problems of persons being unconscious of their superiority claims in their psychopathology. And I think that if you talk to a group of sophisticated Adlerians today and you were talking to them about compulsivity, they would readily assent to the idea that behind compulsivity are superiority complexes. And so that would be the bridge to what we're talking about today from the Adlerian camp. But again, I'm just saying that Adler and Hillman, they are not interested in plumbing. They don't talk about any plumbing. So they're not going to help you get any sense of deep structures. Neither one of them will give you any help with understanding what the deep structures are underlying this phenomenology they described. So now let me add Jung and Kohut to this picture, and I promise to keep it brief. First, let me just talk briefly about Jung. The radical, people need to understand the radical difference between Jung's thought and Freud and Adler. I like to say lately, when I'm talking about Freud, he really did have certain insights and beliefs about a collective unconscious, that is, an unconscious that was shared by all human beings, because he thought Oedipal issues were universal in human beings. And so for Freudians to say they don't believe in the collective, classical Freudians to say they don't believe in the collective unconscious is really kind of cute, because Freud, in fact, had huge assumptions about what all human beings shared in terms of their psychodynamics. And that is an anticipation of what Jung called the collective unconscious. But in Jung, you get made up clear and up front a distinction between the personal unconscious and the collective unconscious. Let me refer you to the work of Anthony Stevens, particularly his book called The 2 Million Year Old Self, and his work called Archetypes and Natural History of the Self, who gives some sense of the kinds of assumptions that Jung had. Also, Stevens' book called On Jung. Read On Jung, Archetypes and Natural History of the Self, and the 2 Million Year Old Self, all by Anthony Stevens. The point being that Jung believed that the human psyche, that the collective unconscious was what he called the objective psyche. There is a psychological inheritance that comes with you when you're born. You're not a tabula rasa at birth, like the old behaviorists used to think. There is a lot of plumbing that comes with you into the world through your DNA, and that just as other species, we have a species psychology as well as a personal psychology. And that just as certain fish know where to go to spawn, even though they've never been there before, and birds know where to go roost, even though they've never been there before, that our species has these inborn codes. And he called that the collective unconscious or the objective psyche. Now, how does that relate to the personal psyche, the personal unconscious of the person, and the personal conscious mind, personal ego of the person in Jung? Well, I recommend here that you read classical books. The best introductions to classical Jung is still, in my view, the books by Jacobi, called The Psychology of C.G. Jung. That's Yolanda Jacobi. Psychology of C.G. Jung, and the book called Complex Archetype and Symbol, and the book called The Way of Individuation. She was brilliant expositor of his basic theory. And then as a contemporary representative of Jung's classical tradition, I recommend the recently deceased Edward Edinger's work, particularly his book, Ego and Archetype. Now, how does the personal unconscious in Jung relate to the collective unconscious? Jung believed that the collective unconscious forms a kind of matrix for the development in a culture and in a family and in a person of complex structures. So in other words, every complex that you form as a person in your personality, and the person is made up of complexes. Your personality is made up of complexes. And we don't need to mystify that. All a complex is a system in your psyche, in your personal psyche. It is an organized system in your personal psyche. It's an organization. It's parallel to what object relations theorists call objects in the psyche. It is partially that. But from a Jungian point of view, the ego consciousness that is interacting with us here in this room today, and every one of us, is a complex. It is an organization. It is a limited organization. And the egos that we bring here are more or less functioning well to regulate our interactions with our environment and our inner environment. And so in our families, according to a Jungian point of view, the curses and blessings of our culture are mediated to the child. And we could even include Adler's understandings of, Jung appreciated and drew on the work of Freud and Adler a lot. And he said that, for the first half of life, he really thinks their psychology is adequate. Because he's talking about, complex formation, the formation of structure in the personality so that the person can deal with their personal life, with their vocation, form of relationship with the world, find work, find love partners, and so on. So anyway, so in your family, your family sort of helps you select or eliminate certain archetypal potentials that are in your codes, in the collective unconscious codes. And so there's no such thing as a culture or no such thing as a person who manifests all aspects of the collective unconscious. Formation of a personality or an ego identity, as Erickson called it, is a selective process and a process of exclusion. Jungians talk about the persona. Persona we form. The persona is a process of exclusion. And if you're a puer or puella, that is an immature man or woman, you have trouble pruning your life, gardening. That is, you just don't go in there and prune. You don't make decisions about what you're going to keep and what you're going to let go. And as we shall see this weekend, a tendency not to prune one's life is a manifestation, a clinical manifestation of grandiosity, fueled by the archetype itself. That is, say, a human in the incarnating into the world has to face limits. And, Edinger uses the Christ image in that book, Ego and Archetype. And, you don't have to get into theology to understand that becoming a person is a crucifixion, because you get hung up on certain coordinates of space and time. And it is a constant, painful encounter with limits, human life. Constant, painful encounter with facing limits and the struggle with mortality. We were talking with Greg, some of us, that we ought to use some of our own lives as clinical illustrations about how difficult it is to cope with with facing limits and really truly claiming our vocation as the unique person that we are in the unique time and place that we're in, and not trying to do everything perfectly yesterday, you know. And we'll get into that tomorrow. But Jung knew that in order to form a persona and an ego, a persona, a workable relationship to the everyday world, and an ego consciousness that is not subject to splitting and fragmenting and being possessed by unconscious contents, that you have to exclude a lot from your consciousness in terms of your formation of the self in the first half of life, hopefully. Some of us are still trying to form ourselves well past the midlife process. But Jung was real interested in this first half of life task and then second half of life task. You know, he was really kind of the first person that really gave a lot of attention to life cycle in psychology. But in terms of our purposes here, this sense that Jung had of the archetypal self and of the archetypal structures in the psyche was sort of the breakthrough understanding in terms of what we're talking about here. The sense of the impersonal nature of archetypal forces in the unconscious that are, as Jung put it, numinous. Now that's a big word for us today. That is, that in the psyche there are these archetypal forces, and they are numinous. Now it's important to get a feel for this stuff about numinosity, and that's a term that comes from Rudolf Otto's work on the idea, the phenomenology of the holy, which got badly translated into English as the idea of the holy. One really was das Heilige, which means the holy, which gets a lot better sense of what Otto was talking about. Otto wasn't talking about an idea. Otto was talking about a force, boom, of power that the holy presents. And so this term luminous, Jung borrowed to talk about the energy and the magical power that one encounters when you get into connection with these archetypal realms of the psyche that is larger than human energies. Otto had said that when you encounter the holy, you have an experience of mysterium tremendum and mysterium fascinans, meaning tremendous mystery that leads you to want to fall to your knees in awe. It is totally beyond you. It's totally other and beyond you and greater than you. And at the same time, you have awe and fear and terror before the sacred when you experience it, before the numinous. You also have a tremendous attraction, mysterium fascinans, mysterious fascination. It's a compelling, spellbinding power. And so Otto's work was borrowed by Jung to describe what it's like to encounter the archetypal dimensions of the psyche. Huge, it's powerful, it's clearly not me when I'm still sane, or relatively sane. I know it's not me. But that's only a small window of time there if you don't have regulation capacities, because when you get in touch with the archetypal dimensions of the psyche and its energies, there's only a brief window of time when you can still say no. And then it has colonized you. And I'm so fascinated in the academic world today. There's so much interest in colonial theory, neo-colonial theory, that is all about how colonization occurs. Well, I've thought about that a lot, and you know the devastating results of colonialization in world culture. And I have realized recently, my God, what a wonderful metaphor for the way the archetypal psyche relates to the human ego. It will colonialize you if you're not extremely awake. So Jung had a tremendous sense about these energies. And it's quite simple why he saw this in a way that Freud and Adler did not, because of their patient populations they worked with. Jung worked in a huge mental hospital which dealt with psychotics and schizophrenics prior to psychotropic medications. And so when he walked into his wards, he didn't have any question about the difference between a personal psyche and something that was clearly not that person coming out of that person. Because he heard voices all the time. He met people like Napoleon all the time, and Christ and Hannibal and all that sort of thing. He met them all the time in his day-to-day work. And so, for Jung, it became very important to explain the structures of the continuities of the voices he heard coming out of his patients in the Burkholzsee. Whereas Freud worked with upper-class neurotics, and chiefly. And Adler worked with poor people struggling with life, and was the founder of community mental health, really, in his work. So the populations that Freud and Adler worked with were radically different from that Jung worked with, and so the phenomenology they were familiar with was radically different. And Jung just happened to be in a place where he saw, for his own eyes, day-to-day basis, impersonal contents that were speaking out of people's bodies. And so his discovery, we might say, of the collective unconscious in the sense we mean it today, was a function of where he worked clinically. Yes. Well, let's say it's impersonal. So let's say that all of these instances that you run into where people suddenly become the great self, suddenly they are the great self, and they have different names. Depending on the cultural background, they'll have different names. And but that is an impersonal content. That's an archetype. So you read archetypal. Archetypal is not personal.
So they're not truly reborn then in the true Christian.
Well, right, they're not. I mean, because
Individuation is holy.
Right. See, the problem is that all these spiritual traditions understand about spiritual development, some understandings of that. But until the modern era, they were not interested in developing an ego self-axis. Let me just get to that in a minute. They wanted to get rid of the ego. And so you got to understand that the idea of the ego that you and I have today is really a modern phenomenon. It's a historical phenomenon that didn't come on the world scene until the modern era. And Ettinger's work, let me just get into talk about Ettinger's work briefly, and then we'll open it up and we'll discuss this until we have to stop. But Ettinger, in his book, gives diagrams showing that when a child comes into the world, the child is impersonal. That is, the child is still in what Freud called the oceanic merger. And the process of personality formation is the capacity to learn to differentiate oneself from the collective psyche. And you can see why, if you're a baby, you want to cry. I mean, even, some people say, well, they're just exercising their lungs and everything. Well, there's a lot of interesting infant studies, but the thing about it is, if you have this sense that a child is one with the world until it has all these very disappointing experiences with caretakers, and then it begins to differentiate. All the literature on the development of personality from infancy, it works on this whole thing of the gradual capacity to differentiate from the other and to maintain some sense of an I while still being able to maintain some relationship to the other. All that object relations theory in psychoanalytic thought focuses on that whole thing about what is me and what is not me. Because the infant, according to Jung's position laid out in Ettinger's book, first of all, it's all me. That's sort of like I am the state, except with the infant, it's I am the world. It's not even I am mommy. People are wrong when they say it's I am mommy. It is I am the universe. And then gradually, maybe I am mommy, and then maybe, so the I gradually begins to form boundaries which are more or less functional to maintain a personality regulation. Can you follow that? And so the honest thing to say is that almost all of us, and I'm kind of cynical about this, I say all of us, including all the analysts and all the therapists, are in a continuing struggle to be able to distinguish between I and not I. And so all these nice fantasies of the adequate ego function are really kind of romantic in my view, because I know too many psychologists, psychoanalysts, and psychotherapists to romanticize us as a mentally healthy group. I really think it's a romantic illusion or delusion, because we're all struggling to find that mode of regulating the I in relationship to the not I, both the relational not I, human not I, and the non-human not I, or the non-personal not I. It's an ongoing struggle. The archetypal self for Jung was a lot of things, but it had the capacity to help regulate the individual's personality function if the ego was developing in a normal way. You could get a sense of differentiation from the archetypal self, but you also needed to maintain a relationship to the archetypal self, because there are two centers in the psyche, according to Jung. One is the developing ego center, the I center, and then there's the archetypal self as a kind of center, a regulating center. And the goal, according to a classical Jungian point of view, is to form an adequate connection between the ego center, the I that's looking at me, and the regulating center that he thought was in your unconscious, in the collective unconscious, and which helped you balance opposites. So here's the question and the answer. The question is, what is there in the archetypal self or in the collective unconscious that is regulating, that will help you? Answer: it is the transcendent function grounded, you can argue, in the non-ego center, which is the archetypal self, that the capacity to mediate opposites in the personality and to try to overcome one-sidedness in the personality is the regulating function of the archetypal self. And here's the good news and the bad news. The good news is, in that classical Jungian point of view, is that there is something in you which will try to arrange for you to balance your opposites. In other words, if you are too nice, there is a process going on in your unconscious, probably unknown to you, which will arrange for you to run into aggression. It will see to it that you meet aggression. You will either meet it in yourself, acting it out, or you will meet it in others. Usually it's both. So in other words, a naive, sweet, nice ego consciousness, if from a classical Jungian point of view, can assume there's going to be what he called an enantiodromia, E-N-A-N-T-I-O-D-R-O-M-I-A, enantiodromia. There is, in that yin-yang thing that you see, that little yin-yang that's got a dot of the other side in each side, that there is a process going on in your psyche that in whatever way you're one-sided, there's a special delivery package coming toward you from the inside and from the outside that is going to confront your one-sidedness. Now that's the good news. It may sound like not too good news, but it's good. That is the way the collective psyche will try to regulate you. But I got to tell you the bad news, which romantic Jungians neglect, and that is, if you persist in being asleep and unconscious, the unconscious mind will up the ante on the package. First you'll get a letter, a telegram, then you'll get a letter, then you'll get increasingly larger packages coming your way, and pretty soon it'll be a letter bomb from your unconscious. It'll be what's that guy's name that sent all those bombs out? The Unabomber. the Unabomber in your psyche will start sending you explosive devices. And the bad news about the self-regulating capacities of the unconscious is it's not nice, it is not ethical. If you persist in ignoring it, it will continue to turn up the heat in such a way that it will destroy you. And that's where all this talk about in Edinburgh about the unconscious God, or the Yahweh in the psyche, which is not kind and loving. That's where that talk comes from. It is the awareness that the archetypal self, ignored, will become a destroying force in the life of your ego consciousness. Now let me just stop there and open it up, because this is classical Jung, and I'm trying to make clear that those people that think the archetypal self always is going to send you flowers, they are romantics, and it's not true. And so Jung's psychology, his classical psychology, is a psychology that has an ethics of awareness. And you get aware, you wake up, or else. That is the assumption that Jung operated on. You maintain your unconsciousness at your own risk, and the risk is terminal. And so a classical position in Jung, if you're really adequate to Jung, Jung is no more romantic about the psyche than Freud. That is, both of them had what you might call a very dark vision of the prospects for the human ego. And so sort of Jungian cultists that sort of assume that all is going to be well automatically. If you just look at your dreams, they're really out of touch. So let me open it up now. We've got about 15 minutes to let me respond to questions about any of this material about the archetype, compulsion, and fragmentation. You can see that the religious heritage, they all knew that getting in touch with sacred energies was not something you do without tremendous care and fear, actually. And the early psychoanalysts saw clearly the phenomenology of what we're talking about this weekend. They saw that there are these really pretentious forces in the psyche, extremely pretentious. I like to call them the God complex, you see. Pretentious for things in your psyche that think they're God and that want to colonize the ego and tyrannize the ego. And if you think, we'll be cheering with each other later, but if you think about the perfectionistic pressures on you that you think you're putting on yourself, what I have to say to my patients and to you and to whoever's listening to this is that your perfectionism is not coming from you. You may think it's coming from you, but your perfectionism is coming from impersonal content, an impersonal organization in your psyche that cares not one whit about you as a human being. So what we have to understand is that this ubiquity of compulsivity in human beings is there because our species has got a psychic apparatus which uncontained and regulated by very awake spiritual and psychological elders, that one is very vulnerable to possession states by the objective psyche. Any way, any spirituality, or any way with a capital W, which requires that you rigidly be perfectionistic or rigidly exclusive in some sort of symbolic content, is really what we call in clinical circles a manic defense. It is a manic defense, and it clean up, paint up, fix up. try to stay above all of my dangerous plumbing and the dangerous disorders in my plumbing. And I try to stay away from my felt experience by retreating into some sort of religious triumphalism. Christians do it all the time. It's not just Course in Miracles. Any people that are taking refuge in unconscious ways in religious forms and practices are probably participating in manic defenses. But I just want to say that it doesn't matter what the tradition. One of the keys of compulsivity is rigidity. And so anytime that consciousness is pushed toward rigid conceptualizations, you've got a manic defense against the unregulated aspects of life. Okay, let's hear from any of the others of you that have a comment or question or reflection to offer on any of this material before we take our lunch break. Yes, thank you.
I've only been familiar with your work. I know your books, but have not.
Well, she's raising the question. She was reading for the tape. She's reading in Anthony Stevens' Archetypes, A Natural History of the Self, and she was reading about the transcendent function. And her question was that does the transcendent function arise out of the conversation between the ego and the self, archetypal self? I don't think I would want to personally formulate it that way, because what the classical notion of the transcendent function is, it functions whether you are aware of it or not. It functions whether you're trying to balance your psyche or not. That is, that enantiodromia, that return of the opposite, or as Freud always said, the repressed will return. That repressed is going to return, and the return of that repressed at you in the form which is in your unconscious is guaranteed whether you have any conscious awareness or not. So I would say that the transcendent function is an automatic mechanism to balance your one-sidedness. It's probably based in physics, in my view. In other words, more and more I realize the Pythagoreans had it right, that the Pythagoreans understood that there's a geometry of the psyche, and today, in our context, we would say there's a physics of the psyche. And when we're speaking of psychodynamics, if we're really going to have a scientific psychology, what we're going to have to do is bridge between physics and psychology, and geometry and psychology, and the other physical hard sciences in psychology. So I personally am going in a totally 180-degree different direction from a lot of contemporary psychoanalytic practitioners who are trying to say psychoanalysis is not a science. I'm saying, well, then they should stop fooling with it. Because if it's not a science, it tends to become a cult. So that's what I don't like about archetypal psychology and the sort of unnamed school of James Hillman. And that's what I don't like about certain tendencies in contemporary Freudian tradition psychoanalytic self-psychology, which they want to say they're not interested in connecting it to science, that they're doing an introspective psychology that's about vicarious introspection, and they're not interested in relating it to scientific theory. And I think that's leading us down a pre-modern cul-de-sac. And I think that we have to actually get clear that that transcendent function is probably based on what we call systems function, self-regulating systems function that we can observe in all sorts of phenomena that's not human. Self-regulating biological systems. So I don't think it has to do with the kind of consciousness that Ettinger's talking about. In other words, if you're really going to have the best chance at being optimally human, you start talking back to the unconscious. And you start trying to form the ego-self axis and becoming awake. You start becoming, whoa, I am trying to fly this 747 and I never looked at the manual. So here I am up here at 40,000 feet over the North Atlantic, and it suddenly dawned on me, whoa, there's a lot of machinery here that I do not understand. And the thing is on automatic pilot right now. How am I going to land it? That is the condition of the human psyche when it's waking up to the need to be awake. Does that metaphor get you? Because that is exactly the condition we're in. We're not on the ground. We're flying at high speeds, at high altitudes, and we're on automatic pilot too much of the time. And we've got to wake up, find the manual, and figure out how to land the thing. And a lot of compulsivity and a lot of manic behaviors that we get involved in are because it's on automatic pilot, and we're flying high and fast, and we're not awake. Yeah. Yeah, that's how a lot of us feel. See, she says that's how she feels right now. Well, here's another piece of the bad news. To the extent that you're in any transition state, what I've written about in the psychology of liminality, to the extent that you're in any life transition, whether it's a life cycle transition or whether it's a transition caused by some catastrophic event, either physical or relational or vocational, you are really in that place, flying high and fast and without celestial navigation. And so you can see why the old peoples of the earth put so much emphasis on rituals and ritual containment in community, because they knew that these things come about in life, both life cycle things, and they created rites of passage. The best they knew, it was state of the art. Every tribe tried to do the best job they could with creating the ritual software to help their people go through these crazy times. You know, that book by Cynthia Trafford, I think it's probably the best book on divorce ever written, called The Crazy Time. The thing that she didn't say is that any transition state is a crazy time. Yes. Everything. Yeah. Yeah, yeah. Yes. Now she, for the tape, she's commenting on information overload. Now, I want us to come back to that this weekend when I'm talking about the possession states of our profession, because frankly, our whole culture, and increasingly world culture, this information overload is a result of a one-sidedness in our culture, an archetypal one-sidedness in the emerging world culture. We are emphasizing those things that have to do with what I call in my work, and we'll get into that this afternoon, magician energies. Magician, the constellation of archetypal energies having to do with the magician archetype. And contemporary culture increasingly is dominated by thought and aggression. And those two phenomena are in the archetypal configurations I call the magician archetype and the warrior archetype. There is extremely little conscious energy going into nurture, which is the royal archetypal structures that I'll lecture on this afternoon. And there's very little energy going into any kind of conscious and mature affectional embodiment. That is, our culture is increasingly moving back into what Freud would call a polymorphous perverse eroticism because of lack of regulation, and mature capacities of empathy are going down rapidly. So what we're developing a world culture which is based on aggression and knowledge, technical knowledge, what Paul Tillich, the great theologian, called technical reason, as opposed to what he called the spiritual wisdom stuff, which would be ontological reason. Tillich saw the horror of our current situation that you're describing. Information overload is a triumph of technical reason over other aspects of human mind and personality functioning. And so, unless we wake up soon to these archetypal imbalances, the larger transcendent function is going to successfully send us explosive packages. Those bombs falling on Yugoslavia right now in a massive and self-righteous way are a part of the enantiodromia of contemporary technical culture. That is, our capacity not to feel what is really happening to Serbians is a part of the collective psychosis that is rapidly gaining ground on this planet. And so that is a huge area that I just want to acknowledge you're right. And one of the things that we've got to talk about tomorrow in terms of, well, what do you do if you're trying to be a person now? And what do you do if you're trying to be a healer now? What is it that you need to do besides learning more information, getting more theories, getting more statistical studies? There are some very straightforward things. You have to stay embodied. You got to get into your body. You got to get into meditation. You've got to get into things which help you be centered and calm, a calm, centered presence in the midst of this chaos, this Koyana that the Hopi Indians talked about. And that's a tall order for anyone. And for a healer, look, all of you people that are clinicians, or you people working with persons who are in crisis of various kinds, we have to be clear about how much toxic, chaotic material comes into our egosphere every day. And so one of the main things we have to talk about Sunday before lunch, right before lunch, is self-care techniques so that the cultural splitting that's going on now will not just colonize you. I can personally attest how hard it is to try to stay even half adequately centered as a clinician today. So that's a very important point. Now, let's see, we've got to take our lunch break now. Thank you very much. What do you do? Don't get me in my shame now. I'd like to turn now to this next section in which we'll work with until 4 o'clock. And I want to do several things which we need before we move into our clinical and therapeutic discussions tomorrow. And what I want to do is to talk about contemporary psychologies of the self just briefly, and which I consider myself a self-psychologist. And I want to give some appreciation to Heinz Kohut and his followers, with the guidance of Dr. Margaret Shanahan, my wife. I have come to study and appreciate the School of Psychoanalytic Self-Psychology, which she is something of an expert in. And it's important, I think, for us to give some credit to Kohut and his followers, at least the persons that still seriously are trying to develop Kohut's own tradition. There are some people in so-called self-psychology circles, psychoanalytic self-psychology circles, that, in my view, in view of others, are doing as much to lose the unique contribution of Kohut as some Jungians are to losing the unique contribution of Jung. But I just want to begin by saying, with the work of Heinz Kohut, in my personal opinion, we have made a revolutionary leap forward in asking the kinds of questions and doing the kind of reflection, clinical reflection, on the psychology of the self, both the little s human self and I think personally the capital S archetypal self. I think that there's been a huge move forward in clinical understanding through Kohut's work. I just want to briefly talk about a couple of aspects of his work, give you a reference if you're not familiar. How many of you have studied Kohut? So a number of you have. That's excellent. The work that I would recommend as an introduction and overview would be the work by Ronald Lee and others called Psychotherapy After Kohut. That's a nice overview and has bibliography that you can use to get more familiar with that. For an important Kohutian contribution to these whole psychologies of addiction and compulsivity, I recommend the book by Lewin called Treatment of Alcoholism and Other Addictions, a Self-Psychological Approach. Kohut began, as Jung did, as a Freudian analyst, and soon realized that there were some things presenting in his analyses that classical Freudian theory didn't help much in understanding them, these patients, and certainly didn't help much in treating them. And this was Kohut's discovery of what came to be called the narcissistic transferences. Freud had believed that there was one line of development, which we later called, in the personality, called the object relations line of development. And that personality development was from a self-involved, narcissistic place to a genitally related relation, appreciative and gentle relation to the object of relationships. And so Freud's understanding of narcissism was sort of like what we studied today in Otto Kernberg. It's like, you know, if you're narcissistic, you're bad. You know, you're self-involved and you're not related. And the challenge, according to that classical point of view in Freudian circles, was that you get past your developmental arrests and fixations, so that you can really love and work, so that you can get your assertiveness and your sexuality integrated. Certainly that you can get past your aggression, so that you can relate in a gentle and fully gently sexual way to others, to other persons. Kohut, in the early days, did not really deny that as a line of development. He thought that the object relations line of development was right. But he saw another line of development, and he called it the narcissistic. It was the narcissistic line of development. Not only did you have to develop in your relationship with others, but you had to mature in your relationship to yourself. And so this is what we could call, for being simple, just being simple, a line of development for self-esteem and the capacity to really enjoy yourself, to really appreciate yourself. I was saying in one of my classes the other day that, you know, think about yourself. Just how interested are you in yourself anyway? One of the things we will observe clinically is that many of our patients cannot sustain an interest in themselves, a focused interest. In fact, one of the hardest things about a person coming to therapy and really becoming an ally in the therapeutic process is that, and this is, John, in your territory here, it's shame over having anybody really take my material seriously. A shame reaction about being looked at, not in that hostile, contemptuous gaze that the French psychoanalysts talk about, but in a genuinely interested gaze. What we have to understand is that for a person to be able to come and sit in your office and to bring a dream or bring some vignette from their life is a bold thing. And we have to be more and more empathic with the struggle of people to be able to present themselves to us for seeing. And Kohut has helped us so much. We will be forever indebted to Kohut for understanding that a great deal of our woundedness is not on the object relations line itself. It's on the relation, the narcissistic line of development. That is, Kohut enabled us to see that narcissism is not a pathological thing in itself. That is, that narcissism is a sector in the development of the psyche, the capacity to not just love the other, but a capacity to love the self in a healthy way, without which, of course, healthy relatedness is not possible. If you are wounded in your relationship to yourself, as you all know, when true love comes your way, you have to rebuff it because you don't feel worthy of it. And there's this little scorekeeper in the psyche that just takes notes on whether or not you're worthy today to have somebody appreciate you, even your therapist. And most days, the little scorekeeper related to our shame will say, no, you don't really deserve this much attention today. And if I'm your patient and you give me too much attention, more than my shame will allow me to take, then I will not be there the next session. My car wouldn't start or something like that. But I got more than my allotted amount of seeing in that last session. Yes. Exactly. Precisely. Exactly. one of the things that we're all trying to be more sensitive to as clinicians is the way in which we have to be extremely empathic about the disorganizing effects of therapeutic attention. The disorganizing effects of therapeutic attention. And so this is where Kohut was a genius. He had such capacity to understand the empathy required for a therapist not to overload the client with affirmation or seeing or recognition or all of those things that we assume that people can take in by the court without getting indigestion, you know. But Kohut helped us to get a sense for the fragility of us and our patients on this front. So anyway, that second line, that narcissistic line of development, and he began to illuminate sectors in transference, countertransference relationships, which had heretofore been, while partially recognized, left in a lot of darkness. While, for example, while classical Jungians have been very aware of projection and recollection, a la Maria Louise von Franz's wonderful book on that topic, Projection and Recollection in Jungian Psychology, Jungians have not been very sophisticated in classical circles about these narcissistic issues. They have not really given adequate attention to, until recently, to these narcissistic dimensions of transferences. What is really happening when someone presents themselves as arrogant and inflated? Jungians have been extremely quick to note inflation and attack it when they see it, and to sort of pathologize exhibitionistic presentations, and that's why they tend to overvalue and privilege introversion as much as they do. You know, Jungians get into a kind of a compulsive overvaluing of introversion in their particular location, their particular social and theoretical location, and so they've not had the kind of subtlety that Kohut brought to understanding what is going on when someone presents to you in a very powerfully recruiting way, being exhibitionistic to recruit your admiration. So when Kohut got into his wonderful descriptions of the so-called idealizing and mirroring transferences and countertransferences, this was a very important day in the history of development of psychoanalytic research, in my view. And just quite briefly, for those of you that don't know, let me just say that Kohut paid a lot of attention to his observations of certain types of patients who would come into his office, and when he would try to interpret anything to them, they would become very upset, and they seemed to simply wanting to sit there and listen to them, sit there and watch them and listen to them, and not interpret at all. And he began to realize that there was this thing called a demand for a mirror transference, a mirror transference, which is my desire to have you sit still, not call attention to yourself, and let me display myself before you as I feel that I can, to have you see me and recognize me, and no matter what I'm talking about, for you to show interest in it, and as we said earlier, not too much interest, but you to show the right amount of interest in it. And Kohut began to be aware that when therapists are in the presence of this kind of demand from a patient, that the therapist feels very attacked and desirous of ending this relationship, referring the patient. They don't give the therapist enough mirroring, you know, of themselves. So anyway, and so that was one pole of this bipolar dynamic that he noticed. The other one was the idealizing pole. And that was an idealizing transference field, where the person was looking, constantly scanning for idealizable, what Kohut calls self-objects, persons that could carry the sense of wonderfulness that the person needed to believe existed in the world. That is, somebody that could carry that sort of more than human aspect of our longings. And so in Kohut's work, he began to believe, and I think quite rightly, that as we're developing, we have these two narcissistic dynamics going on. We need somebody to see how precious we are, but see us in an amount that we can stand at any particular time, until we can gradually gain a sense of self-esteem, and that we need someone to believe in, someone larger than life, larger than human to believe in, until we can take them down slowly off of their pedestal and integrate a sense of secure values into our personality, a sense of what is really golden in human values and in the human spirit, and integrate that into ourselves. And so the task of transforming one's really sort of unregulated, exhibitionistic, demanding narcissism into healthy self-esteem on one developmental aspect there, and then transforming our need for the perfect other into values that we feel are really authentic and have integrity. Those two things Kohut saw. He opened, in my view, a real possibility for extending the discussion about the archetypal self and its dynamics and its clinical implications for Jungians, for those Jungians that have eyes to see. Because Kohut believed, and he's not a Jungian, these Kohutian self-psychologists, most of them don't know anything about Jung, and every time they discover something that Jung already discovered, they think that they're original. It's really embarrassing. I have shame reactions for them. And how completely ignorant they are about so many things. They have recently discovered the importance of art therapies for coming into touch with important dynamics in the psyche. And I'm just amazed at this brilliant discovery that they've had. But in any case, the thing that I have been so excited about the capacity to deepen our reflections on the clinical implications of the archetypal self, the great self, is that they did see, Kohut and his closest followers realized that there was this thing called the grandiose exhibitionistic self-organization in every person. It was not the ego, and was not the material human self, with a little s. But that this thing existed in the psyche of every person, and every person in their maturation process had to deal with the reality of this grandiose exhibitionistic self-organization in the psyche. Now, recent recent self-psychologists have begun to diminish the importance of that insight. They have not really gotten the importance of that insight, and therefore they've just kind of bounced off it and gone right by it. But you see, what they are seeing there, what Kohut saw, in my view, was the same thing that Freud was picking up on the superego and the id, the power, that huge power of those things in the psyche that had to be regulated. It's the same phenomenology that Adler intuited when he saw the presence, or the ubiquitous presence of the superiority complex behind all inferiority and entitlement claims. And Jung's sense of the archetypal self as an independent psychological organization in the psyche that is not the ego and not the little s human self. That is, that there is the sense that there is this huge thing that has to be dealt with clinically and is behind addiction. It is behind for Kohutians that have thought deeply about this sort of thing. The grandiosity is a huge clinical issue for every patient. And it doesn't mean that they all are mainlining it, shooting up with it, mainlining it, as much as really what we call loosely organized personalities. But the truth is, a knowledgeable Kohutian therapist will be very aware of how you're doing regulating your grandiose exhibitionistic fantasies. Are you putting them in, totally splitting them off, putting them into the unconscious, so that you're not even aware of your grandiose fantasies? Are you that's called a horizontal split. If you are in vertical split where sometimes you think you're Caesar and sometimes you think you're shit, but you're aware of it both times when you are in it, you know. That's a vertical split. So that sometimes you are flying and you're wonderful and you know it, and then you're, as one man said to me this past week, and then I am in the trash can. And he knows it. So the oscillation between the presence in the conscious mind of these highly elevated, highly grandiose self states, and then terribly fragmenting and depressive positions, depleted and depressed positions. Now, I simply want to say, to give credit where credit is due, I think this was a brilliant clinical discovery. Its clinical implications of it are so important. To be able, for therapists to be able to be sensitive to what's going on with the grandiosity in their patients. And in terms of the countertransference, what is going on in my grandiosity as a therapist? And how does this patient humiliate me and wound my grandiosity so that I have to act out in a hostile way toward the patient in the countertransference? So that if they bring in some display, some claim for I am so wonderful and I'm going to let you see how wonderful I am today, so that the therapist doesn't have to make a really punitive, negative, sadistic interpretation of that display. So these, and I might add, my opinion of my colleagues in the mental health professions is not high on this matter, because I personally believe, and we'll talk about tomorrow, that most therapists are so possessed by the magician archetype that they do not want to notice how sadistic they are and how much of a power trip they're in. And so we got a long way to go before we understand the narcissistic dimensions of countertransference in all therapeutic practice, no matter whether it's psychoanalytic or not. But in any case, credit where credit is due, there's awareness that grandiosity is a problem, and it's always a problem. Now, what is the limitations of the Compulsion school on this topic related to what we're concerned about? Cohesions and self-psychologists in general have a kind of a fantasy that grandiosity can be done away with. That at least that is in their theory. They have a theory that they can transmute and internalize this grandiose exhibitionistic libido, and that if you're really analyzed, then that reservoir of grandiosity will be so diminished that it will not be a big problem for you. I'm sorry. I know too many self-psychologists to believe that their grandiosity has been transmuted and internalized. And I mean, I go to the conferences where I'm an observer as an outsider, and it's really, I keep a good sense of humor looking at the narcissistic posturing that I see there and the wounding of each other that they go into in these typical ways that you all are familiar with. In short, if you buy the kind of meta-psychology of grandiosity of the Cohesions in their school, then you would have to believe, at least in theory, that you can get rid of grandiosity. This is where Jung's point of view is far superior, and it's superior in a way we must not lose, and that is that grandiosity in your psyche never goes away. It is never diminished. There is a God organization in there that we call the archetypal self, or the God complex, or the grandiose exhibitionistic imago, whatever that thing is in there, and it's not going away. You can do one of several things. You can either let it possess you, in which case you're going to have an Icarus complex, flying into the sun and crashing. Or you can pull the depressive position strategy, which is what the Adlerians and the Cohesions do, at least in their theory. That is to have the idea that real health comes by repressing the grandiosity, claiming you have transmuted and internalized it, and then hating everybody else that has good self-esteem and healthy narcissism and exhibitionism. and engaging in envy attacks, vicious, sadistic envy attacks on everyone who still has the healthy exhibitionism to put themselves forth as wonderful. And those are two strategies. One, to climb it in an unregulated way, fly into the sun and crash, get into the depressive position, and then get into which always entails an envy mode. You will set up, envy will be one of the chief ways one has of managing one's own grandiosity. Because one will have idealizing projections then without even knowing it. And there will be an idealizing projection toward anyone who has healthy exhibitionistic display. And then you will attack the idealized object. And various, some are aware of it and some, and most are not. That is to say, most, if you will notice how uncomfortable most people are with anyone's exhibitionistic display and how they have to depreciate it. Adler saw it. He called it the depreciation tendency. And Adler saw clearly, clinically, that the healthier you are, the less depreciation you will do of others, even if they are exhibitionistic. That the healthier you are, you will not have to depreciate others, even their exhibitionistic displays. You will be able to see the needs, the human needs and longings behind exhibitionistic displays, including the legitimate ones. So the third. Say that again.
You mean I got to give up hating people that are in it?
Yeah, right, because it's the same. Hating anyone for their conspicuous displays is just the same dynamic. It is a way of our managing our own grandiosity. Anytime and hate is a big way people use to manage it because it's narcissistic rage. I am not in touch with my grandiosity in a healthy way, and therefore I'm on the edge of narcissistic rage anyway. If I'm not in touch in a healthy way with my grandiosity, I will be on the edge always of narcissistic rage because I feel that somebody's stolen something that's legitimately mine. Because I know in my heart of hearts that there's some preciousness in me and some worthiness in me. As the Christians would say, there's a God imago in me, there's a God image in me, the image of God is in me. And the Hindus would say that there is the Atman in me. And I say to you, thou art God. And I need you to say to me, thou art God, in order to acknowledge that thing in me that is bigger than me. And so anyway, but Kohut opened the door for us to really see these dynamics. But the Kohutians and the Adlerians and almost all other schools radically pathologize what we call narcissistic personality disorders. And that is why, one of the reasons why that narcissistic personality disorders get so little help is because they're so handy for all of us to use in regulating our own grandiosity through the depressive position and hating them. And so for those of you therapists listening to this, you will be effective at helping narcissistic personality disorders exactly to the extent that you work consciously with your own grandiosity in a non-hostile way. That is, that you learn not to be hostile to your own grandiose exhibitionistic libido, your own, the great things in yourself. And we'll talk tomorrow about some clues about how to relate to your grandiosity in a healthier way. But we should be clear that to get into a fantasy, as the self-psychologists do, that their grandiosity has been transmuted and internalized by their 10 years of Freudian analysis or self-psychological analysis, is a dead end. That does not work. It doesn't work because there are these enduring structures in the psyche that Jung saw that are the great self. It's huge. It will remain huge. And this is why the contribution of Edward Edinger about this developing the ego-self axis, not becoming the archetypal self, not declaring that it doesn't exist, but recognizing that it will always be present, and one's task is to relate to it consciously in a way that is optimum as possible. So that's all I want to really say about psychoanalytic self-psychology, except to say that in my personal judgment, and I by no means am idealizing them, I think there are many flaws with their treatment methods and their assumptions about treatment, and their inflated assumptions about how much they've transmuted their grandiosity and how much they can get their patients to do that. But I want to say that they have enabled us to think at the micro level, clinically, at the micro level about these issues of the great self, the grandiose energies. They've enabled us to get much more specific about seeing these energies and understanding how they impact patients. Classical Jungian analysts will interpret your dreams, and a lot of the time they will not be aware of the grandiose dynamics going on, and sometimes they will respond too enthusiastically to archetypal dreams, and the person who is already being flooded by archetypal grandiose energies, they get this positive, interested response by the analyst in material that of course is interesting and exciting, but the patient will often experience more interest for an archetypal dream than for their personal issues as being an invitation to get into their grandiosity more and to be less interested in their ordinary struggle. And so we have a lot of work to do to get therapists aware of this geography of this field of how am I to relate to my grandiosity and the grandiosity of my patient in an empathic way, which enables me to help them be interested in every part of their lives and not feel that any part of their lives is boring. That is the challenge. If you come in with one of these sizzling archetypal dreams, sure, that's interesting. I'm always fascinated with that. I could do that, 48 hours a day, But as I really get more empathic with people, I'm much more aware that even somebody that is hugely successful in the outer world, often has so much shame over their personal life that they can hardly sit with me 45 minutes, can hardly sit in my consulting room 45 minutes if I want to hear about their personality. And what I'm saying is we have to understand what that is right there. That is a tremendous wound a shame wound, which results in a person's feeling that their personal life, the minute details of their personal life, is simply not interesting enough to be looked at together with somebody that has goodwill toward them. That's a huge topic in itself. Now let me summarize for you quickly what I have tried to do now in going beyond, I think, Jung's work on this and Kohut's work on this. And what I have tried to do is to look at what I believe to be the crystalline. Jung believed that there was a crystalline structure in the archetypal self, that it was like the structure of a crystal. And if you look in his collected works, and I came to this long time ago after coming up with this sense of what the geometry of the self was, I realized that Jung had really been working on this and had many insights into it, and some of his other followers, such as Tony Wolff and others, had seen into aspects of this. And in some of my books, you can see the diagrams, elaborated diagrams on this progression of insight. But in the collected works, Jung put a number of diagrams where he asserted that the geometrical structure of the codes for the archetypal self were octahedral in shape, that is, two pyramids base to base. And he struggled to understand. He had an intuition about this, and you can look in the collected works, and you can see, and in the appendices to my books to my 4 books on the individual archetypal patterns, the king, warrior, magician, lover, In the appendix, there's a series of these diagrams that you can look at. But in any case, what I have come to understand is that I believe Jung was right, and that the great code for the shape of the archetypal self and the materials in it are octahedral in shape. And I want to go quickly through that. Some of you could give this lecture, and I don't want to bore you by going over this for a long time, but I just want to summarize it for you. If you look up here, on those two top diagrams, you're looking, imagine yourself looking down at the tops of two Mayan pyramids. If you imagine those things, picking them both up this way and putting them base to base, there will be, if you place the related quadrants over each other, you will find that there are actually four faces to this octahedron on the outer surfaces, four faces. One I call royal energy. It is the psychological mechanisms having to do with nurture, centering, vision, the capacity to envision a future for oneself, the capacity to choose what to build and what not to build in one's life. Imaged in many cultures in the image of king and queen, and you see an archetypal symbolism tremendous. Jung was tremendously interested in the archetypal symbolism of the royal couple. I personally think he never figured out why that was so important, but he knew it was. So in my work, unlike Freud, who thought there was one line of development, unlike Kohut, who thought there was two, I think that according in Jung's tradition, Jung believed that there was that the psyche was a quaternio. There were four fundamental functions in the psyche. He came to believe they were typology, sensation, feeling, thinking, and intuition. Toni Wolff had a different idea. She believed they were structural forms, not typology. And I realized some time ago that I am a son in the tradition of Toni Wolff. I am one of her intellectual sons, in that she saw the kind of structural declension that I later came to and based on my own work. The four lines of development are a royal line for as I've said, for nurture and centering, envisioning, capacity to mentor, and so on, parent to parent. In other words, in my view, there's no such thing as a father archetype or a mother archetype. There's only the royal king and queen archetypes under which human mothers and human fathers seek to do their work. It tends to completely miss the numinosity in that structure, because the numinosity of parents that we try to help our clients and analysans work through is an archetypal transference of the royal couple, and the huge abyss for most of our patients between where they are and getting their parents off the pedestal, especially the bad parents, especially the quote bad parents. To get the bad parents off the archetypal pedestal is the warp and woof of most of basic 101 therapy. So anyway, we've got a line of development for aggression. This has been a controversy in the history of the psychoanalytic movement for a long time. I am on the side of those that believe that aggression is a separate line of development. It is not a failed lover line. It's not a failed object relations line. That aggression is a separate line. We have evidence for this from brain physiology. These are separate systems. They're not the same. The affiliative systems in the brain are not the same as the aggressive systems in the brain. So there's a line of development for aggression from out of control, destructive aggression to regulated, creative, world-building aggression. And I don't like to say, I don't consent to say assertiveness instead of aggression, because I believe that's a cosmetology approach to these energies. And I refuse to clean it up. Everyone has aggression. It's not a question of whether it's aggression or not. It's what the aggression is in service of. if one has no aggression, one will never be a successful artist. If one has no aggression, one will never be a successful lover. I mean, it's just we have to deal with all this pathologizing of aggression, which has hurt women so much in history. The identification of aggression with the male has been one of the chief strategies of patriarchy in keeping women oppressed. And the unconsciousness about the importance of maturing aggression is one of the reasons why we have such a violent country right now. Okay, so the third line of development is a cognitive line of development. I call it the transformational line because it has to do with, it's the sector of development which has the awareness, the kind of consciousness that is needed to allow a person to go through transformations, death and rebirth. Jung called it the death and rebirth archetype in his work. I separate the archetype of initiation from the archetype of the magician. I think that it is in this sector that all these transition states operate. But there is a specific function of this line of development to get you the pattern recognition abilities, which are necessary if you're able to map out what's happening to you. So in other words, the capacity to see the patterns in your functioning, which is required for getting on with your journey, and which so many people coming to us in therapy lack. And so, in the best sense, we help them develop their magician line of development. Hopefully, as I'll say tomorrow, we help them do more than that. But we try to give them help in learning to see the patterns of the geography of their life, so that they can recognize the repetition compulsions, which have been so destructive and continue to have their compulsive hold on them. So that is in that magician line. What else is in that? Your capacity to contemplate. That's what contemplation is, what I was just describing. Your capacity to map the human world, the terrain of the human world. Your capacity to utilize your intellectual gifts in a way that serves you in the community, in the world, instead of seeking to exploit and manipulate yourself, your community, and your world. The fourth and final line of development is what I've called the lover line, or the erotic line of development. And here again, I'm just piggybacking on Freud. You see, Freud saw the lover line. He saw clinically the aggression line. So basically, the horizontal axis here, Freud worked that territory. That line is for embodiment, sexuality, affiliation, intimacy, and the capacity for joy. And, of course, the capacity to experience your pain. I know one of the things that John does a lot in his work is try to help men be able to become aware of their pain, and that part of their task is to, instead of splitting off from their pain and acting out all the time in order to avoid their pain, to help them begin to become aware of their pain, to become aware of how they medicate their pain with various concoctions, and the way in which they become stony cold in order to defend against their pain. And so this is something that's not just true of men, though John works mostly with men around these issues. And when this line of the lover, this erotic line develops, a person, whether male or female, is capable of becoming aware of their pain without having their pain sink their boat. Now, of course, if I had more time, I would, and I can speak to this tomorrow if you'll remind me, therapeutic techniques and theories of change need to be evaluated in this context, because there are a lot of therapists that assume that putting you into your pain is going to heal you. Well, it's important to have you have close encounters with your pain, but it's very important for you not to have
someone leads you to believe, or you lead others to believe, that being submerged in your pain in an unbalanced way is going to heal. And there are a lot of folks dealing with trauma victims that have a very erroneous theory of change, and they think that catharsis heals. My personal view, based on this work, is that nobody ever got healed through catharsis. They find out about sectors of their personality in catharsis. So catharsis, I would argue, is a research technique. It helps you find sectors of your life that were lost in repression or split off areas, but it doesn't structure your personality. And healing, in my view, comes only through structuralization. There again, I am in the same boat, the same camp with Koha. Healing is structuralization. Such healing as we will ever know in this life is structuralization, capacity to regulate. Okay, so we've got these 4 lines of development, 4 quadrants, as Jung said, in the personality, although I, with Tony Wolff instead of Jung on what these things are. And the code, if you'll notice, and in my work I've lectured a lot on the asymmetry between males and females in terms of when in the life cycle, statistically speaking, these energies come on in a flooding way. There's a lot of cross-cultural evidence that goes against a lot of political correctness, that statistically speaking, that women become more aggressive in midlife and men are flooded with aggression, testosterone and aggression in adolescence, and that the asymmetry between males and females developmentally that creates so much mischief in relationships at midlife is the asymmetry about when the erotic systems are to the fore in terms of sociobiological unfoldment, and when the aggression systems are to the fore. And wholeness, the task of wholeness in men and women, in my view, are exactly the same. And that is balancing these 4 lines of development adequately through the life cycle. The bad news is that it's just like a football game or a basketball game. At halftime, the ends of the court shifts. And what we tend to do is to not shift our strategies at halftime in a way that keeps our eyes open. Men in midlife have got to not forget everything they learned in the first half of life. That is, if they were able to reach their assertiveness in the first half of life. And women in the second half of life need to remember their great talents for personal relatedness, which they may at midlife have come to view as pathological. But they need to retain the capacities for empathic personal relatedness at midlife that they had when they were younger, without turning their back on the new capacities for focused aggression that a woman begins to power up with after what I think 35. Gloria Steinem used to say, don't send me a woman to work with me until she's 35. And what she was talking about is that's when that focused capacity to be really disciplined and aggressive really comes flooding in on a woman, statistically speaking. Now remember, no individual person, you cannot predict where they are on the 4 developmental lines by virtue of what their gender is. In my family, I was socialized into the female pattern. And many girls, particularly fathers' daughters, are socialized into a male pattern of development early in life. So the good news is that the goal of wholeness requires the balancing of these 4 energies, 4 lines of development, regardless of your gender or where you are in life. And that is the task and always remains the task. And you can see that the balancing of the opposites is the key issue here. It's just that in midlife they play a dirty trick on us. And, the field shifts and we have to keep working on the balancing task. So there is my argument about the way that the code of the archetypal self. Now remember, this is simply the code for the foundational building blocks of the self, the little s self, to be based on these potentials in the archetypal self. there are many archetypal realities that are not archetypes of the self. And so in my other courses I've given here, they're available on tapes, I've made distinctions between complexes which are resulting from split-off aspects of the archetypal self, and complexes which are autonomous complexes which are resulting from other archetypal entities that are not a part of the archetypal self. And that's a distinction made by Jung, one that I adhere to. But in terms of our work in this, particularly the way we're talking about this today, I'm simply focusing on the great powers here, these four great powers in the psyche that are archetypal and that need to be related to in a creative way in order to build an integrated, ongoing self that has the capacity to regulate. And in terms of our discussion of compulsivity, after we take a break in a little while, I will talk about what I view to be the compulsivity leading to fragmentation that is related to each of these quadrants. And but I want to open it up now for this little time that we have before the break, and have you dialogue with me about this thing about the diamond body and the codes here, because what I believe I can show here is that Kohut, when he was working with this idealizing and mirroring transferences, self-object transferences, was really talking about royal transferences, longings having to do with blessing. And if I don't get enough blessing from a parental figure or a significant other adult that I have idealized enough to be significant, you see, the Kohutians thought that these were very separate transferences. In my view, they're all part of the royal system. That is, if I do not idealize you enough, I won't care whether you mirror me or not. You know, if I'm not already projecting royal energies on you, it won't bother me that you don't see me. Well, see, I think it's probably true that this stuff arises simultaneously in the psyche. It's like, you know, you would have to say, you think about the infant. Because, see, the infant is not starting from a differentiated position. It's starting with a merger with the great one. I and you are one. You're the great one, but I'm the great one too. We are merged in this unit. So we are sort of the wonderful unit. We are sort of the wonderful reality. And really, we're really embedded in the world. The world is a wonderful reality until I start having these frustrations by the environment. And so I think that sense of the wonderful object and the wonderful me is really, that arises simultaneously because it's out of a primordial union. And then, of course, you know, all that stuff the Kleinians talk about the good breast and the bad breast and all that sort of thing. This is the territory they're trying to work with in a very awkward and sort of fundamentalistic way, in my view. That is to say, goodness, you know, where is the goodness and where is the badness? Well, no, there is no badness until the frustration of my longings begin to occur. There's not any badness. And then the frustrating environment, if it's really like in our culture where we, you know, until very recently, we would bring a baby into the world in a very cold room. And if it's a boy, we would circumcise it without anesthesia. And then we would often hold it up and slap it hard, and in other ways traumatize this infant, and with the fantasy that people had until recently that the infant has no memory, that the infant does not feel pain. There was only until recently there was a widely accepted theory that infants did not feel pain, and that is only recently changing, and still not changing. I would say the majority of folks still do not understand that infants feel pain and that they have memories. There's a very important wrap around the whole thing that we can't really get into today. But, you know, the whole issue of trying to think about the evolutionary significance of Judaism in human history is an interesting area of discussion. Well, but see, if you understand the symbolism of Judaism, I just want to say one thing about this. There are many of us that believe that that Judaism, in its concept of the Sabbath, of circumcision, and there's another concept in there. I'm trying to think about it, but anyway, it had a sense of standing against grandiosity. It had a primal sense of the danger. Oh yeah, the yarmulke, the cap on the head. There are these symbolisms in Judaism that show the necessity of limiting creativity. And the mark on the penis is a sign of limiting creativity, bringing it before God. The yarmulke on the head is a sign of you covering. You understand that you have got to see a limit here on your manifestation. And the Sabbath, even God rested. Even God did not claim unregulated creativity. And so there's a whole big wrap on that. It's very complicated and very important, and I don't have time to go into it except to say that I believe they were intuiting in a very, very important way the necessity of limits on human arrogance. And the Mosaic revelation is really about containment. And to this day, what humans have learned through the Mosaic revelation is greatly at risk, because Moloch, that is unrelenting human greed and claims to power, are more dangerous today than they were in Moses' day. So that's a whole other wrap that we don't have time to get into. But let me just open it up now. I have said then that what I've tried to do in my work is to build on Jung. I'm what I would call a neo-Jungian. You know that book by Samuel says Jung and the post-Jungians? Well, I personally, I do not identify as a classical Jungian, so I'm not a Jungian. And I do not identify as a post-Jungian like Hillman and the folks that think that they can throw out Jung's fundamental theory. I consider myself a neo-Jungian trying to do a scientific psychoanalysis that's not a Jungian cult, but does not, like Hillman and his people do, throw out Jung's the fundamental scientific work that Jung did. So what I'm trying to do is to carry a scientific psychoanalysis forward using information from as many sources as possible to carry forward Jung's project, but to become more specific than Jung was and less into mystification. A lot of Jungians don't like me and my work because they say, Moore knows too much about the self. And that sounds a lot to me like he knows too much about God. But you see, I don't believe the self is God, like romantic cultic Jungians do. And I believe the self is a psychological structure. And I believe, put my theological hat on, I can give you a theologian's rap. But the self is not God. The self is a psychological structure. And it thinks it's God. And it has God claims on you, and it will treat you like a very evil God in its way it relates to you. But so when I do what I say, decoding the diamond body, I believe that there's enormous information, cross-cultural and interdisciplinary, that supports this, including Theodore Milan's declension of psychopathology, which fits this model. Yeah, Ann Ulanov and I independently came, Ann Ulanov, the Jungian analyst in New York, she and I independently came to a conclusion that the archetypal self is the place, if you want to talk theology and psychology, where God and the imago Dei interact. That there is that you can say there's a connection there. If you want to talk about theology, that if there is a place where God and the psyche connect, it would be in the diamond body. That would be the imago Dei. So, in other words, in my view, that if you want to speak in theological, spiritual terms of a God imago or a Buddha nature, that it is in that kind of code. That's where that would inhere. The Buddhists speak of the true person of no rank in the psyche. It's not the person, not the I, but there's the true person of no rank. I think this is the thing that Jung is really trying to talk about here. Well, I think that what you have to realize is, that is a very big area of discussion, and I'm fascinated by that discussion. I would have to say that that if you study spirituality, you will get a sense that those people, there are many, many people in different traditions that really feel that there's a tremendous sacredness in the human personality. And I don't know how many of you ever studied Greek Orthodoxy, but the Greek Orthodox have tremendous insights about this very divine thing in the psyche. And they really, in their spirituality, they really think your task as a person is to become God. That is, they call it deification, that you really become the divine thing that you were intended to be. And Western Christians never talk about that because it scares them to death. Western Christians are very into guilt and, shame, all sorts of good stuff like that. But anyway, so there's a lot of discussion about that, and I speak about that some in my lectures on the great self within and so forth. But the important thing is to realize that whether you believe you can be an atheist. I don't care if you're an atheist. What you got to understand is that thing that they're talking about, Kundalini, that is in your apparatus. And I can put you through certain things that will put you in touch with that, and it will invade you, and you will experience it. And I don't even have to give you a psychotropic medication. I don't even have to give you a drug of any kind. I don't have to give you mescaline or peyote. I can simply get you to do holotropic breath work. And if I can get you to hyperventilate for about 20 minutes, you will start to open up to some of this archetypal energy in your psyche, and your capacity to disbelieve it will go right down the tubes, because you will feel this incredible energy in your body. And so this is really an empirical matter. I mean, Jung was an empirical scientist, and a lot of these folks that want to make him into a religious figure, a cult figure, that you have to believe everything he said based on doctrine, are forgetting how he interpreted himself. He was a scientist trying to do a scientific investigation into the farther reaches of the psyche, and I think that's what the task of scientific psychoanalysis is. A scientific psychoanalyst is not a theologian or a philosopher. I mean, we're basically plumbers, and your job is to be a good plumber, and then you can send the water off to chemists and other those people that are going to tell you what it is. But you follow me? What I'm saying is that our job is to try to understand these dynamics and what appears in human life. And if you're going to be a philosopher about it or a theologian about it, you need to study philosophy and theology and get to be an expert on that, and not assume that an MD degree or an MSW or a PhD makes you a philosopher or a theologian. Okay, any other comments or questions before we've got a little time before we take a break? Yeah.
There was a question earlier about which comes first.
Yes.
In my experience, a lot of men out there hunger for certainly idealized strength.
Yes.
Probably mirror
Yeah.
as well.
Yeah.
And I usually, to a certain capacity, I want to take it on hold and let it go.
Yeah.
Great. Have you got ideas about the process?
Yeah, about why that is. You see, I really believe that we are so bad at narcissistic nurturing people narcissistically, because we are also wounded in our own narcissism, that actually deploying ourselves in an empathic way to mirror people in a really attuned, effective way as infants on up through childhood, that we have wounded so much. So we have wounded each other in families and in culture so badly that for most people, epidemiologically speaking, just in terms of the epidemiology of this, for most people, the idea of being mirrored, having your beauty mirrored, for having somebody look at you and see beauty and preciousness, is so far away from possibility that's how we understand. This is what Kohut felt, that if you didn't get mirrored, you're going to turn to an idealizing transference to get some narcissistic needs met. But people don't understand An idealizing transference is not the equivalent of a mirroring transference. You need mirroring. You need mirroring. There's no substitute for mirroring. There's no substitute for getting your own sense of beauty integrated in you. And the only way you can't do that through an idealizing transference. You can only do that through learning to accept being seen. And we have to, as clinicians, we have to really be sensitive to how hard it is for people to let them be seen. And these men that come to you, John, they've been shamed so and attacked so. They have had their beauty attacked. They have had their energy attacked. You know, the reason so many boy children are on Ritalin is because there is so little awareness of just the energetic differences in patterns between boys and girls. And so boys, the masculine energy in little boys is pathologized and medicated. And so that's just one current example of how hard it is for people to get mirrored. And so if they are not tremendously depressed, now this is where the depression, if you're very depressed, you will not be searching out idealizable objects. In fact, you can just tell when you're looking at yourself, if you're looking at your analysams of your clients, the depressed ones are not scanning very much for idealizable objects. They've given up. They've consciously given up, and dynamically they've given up. But Kohut is wonderful here. He reminds us, he reminds us, the later Kohut particularly, that if that need for the mirroring and the idealizable self-object, if that has gone to sleep and fixated because of lack of an adequate environment, milieu, it has just gone dormant, he thought. In the later Kohut, it's gone dormant. If it finds itself in an adequate milieu, that is with you, sitting with you, that after some testing, that longing will be remobilized in the relationship with you, the therapist. And so you may notice in your work with people that you'll work with them and they won't invest in you. You work with them a little longer, they won't invest in you. And you try to be as trustworthy as possible, and as empathic and related as possible. And then there will come that moment where those tentative little feelers will come out. Now, can I show you a pretty thing? And they'll test you. And then after they start feeling that they just might be able to be safe bringing that out, then it will come flooding out and scare the hell out of you, the therapist. But anyway, so the idea is that these longings will remobilize in the transference, and it's important for us to realize that those needs will become projected on us, idealizing first often. But if the psyche is less damaged narcissistically, it may go immediately into a mirror demand. So in other words, if they can show you their exhibitionism and demand that you appreciate it, that's pretty good. And if you can refrain from attacking it until after the session, you understand what I mean there? It's like the blatant. You work with somebody and they'll be very self-effacing, and then after a certain point, if they trust you enough, they will bring in that thing that they felt so much shame about, and that is their spiritual experience, which makes them very special. They talk to the Archangel Michael or Krishna or whoever it was, and they will bring this shining little diamond in there, and they'll put it there, and they'll watch you, see how you respond. And folks, it's very important for you to control your communications of contempt or shock or, oh my God, well, envy and jealousy, certainly, but you know, what we tend to do in this flatland, you know Ken Wilber's work, if you study any Ken Wilber, it's very important work. You need to study Ken Wilber to get a feeling of the flatland world of contemporary mental health. And so, you know, the idea that you know, somebody that brings in an experience with Krishna is really, my God, I thought they were this, but they're really a borderline, or worse. You know, they're really a borderline or worse. And you got to control that socialization and just understand that they have just brought in this part of, what is that they say in Hinduism, Randy? What's that thing about the necklace of, is it the necklace of Indra? Indra's necklace or something. They have just brought in this divine string of pearls to show you. And the task here, folks, is to not give them a pathologizing stare. You follow me? And because if you do give them a pathologizing stare, is you're well, you know, you're playing. Well, that's only poetic justice, you know. If some secular psychotherapist gets attacked by the Kundalini from behind. Right, a behaviorist, look out, all you behaviorist atheists on this tape, listening to this tape. Just remember that your shadow is one of these psychotic spiritualities, like, you know, that you have a Jungian psychotic spiritual shadow. Okay, any other questions or comments? At any point in the life cycle, it's going to be a challenge for people of different genders to have empathy for each other at all periods in the life cycle. The predatory male behavior on young females in early life is a function of lack of empathy for young females on the part of young males. And the midlife phenomenon that we see between men and women is that increasingly you will notice that at midlife women become less and less empathic with the personal issues of men as they get older. That's epidemiological. I mean, that's anybody that doesn't see that is not looking. Well, very, and you know, contemptuous and also extremely self-righteous about it. I mean, and what people have to realize is that this thing is not personal. It's fueled by sociobiological agendas, and that the challenge for us all, spiritually and emotionally and ethically, is to find every way we can to enhance empathy for the genders have to have more empathy for each other through the life cycle, and the problems change through the life cycle, so that you can see why it's so difficult. Because there's an asymmetry there that this guy, what's his name, John Gray, picked up in that men are from Mars and women are from Venus. Well, John is half right. Men are from Mars and women are from Venus statistically in the first half of life. But after the first half of life, women are from Mars and men are from Venus. And yes, go ahead. Of course. And you can see that May-December relationships, they totally make sense. But they're not really very mature. Because what it amounts to is, rather than integrating the shadow and trying to gain empathy for the other gender, what one does is fragment and then find somebody that is narcissistically easier to relate to. And so, well, you could write the book on this. I mean, if you just think about it, older women, younger men, older men, younger women, they've got a lot in common, dynamically speaking, statistically, in terms of the probabilisms, and so it is a challenge for people. What was the name of that movie? I just saw it last night. That Sean Connery and it was about an older couple. It was about their 40th anniversary celebration. No, it's a different one. This is about a 40th anniversary celebration of Sean Connery and his wife, who's played by a beautiful aging actress. And it's really about some of this stuff, all this stuff. It's a beautiful movie. I wish I could think of the name of it.
I worked in an all-black school.
Mm-hmm.
As an orchestrated practice. And I would say, specifically the younger generation, the women that I'm working with are still extremely warrior.
Mm-hmm.
You know, they're gangbangers, they're junior high, they're constantly violent. You know, we have two kids. Tell me the other day, woman, and there's no nurturing coming out of these women nowadays.
Well, that's a long story. She's talking about phenomenology we're seeing in young female gang members. And yeah, I know, but don't kid yourself. If you look at the statistics on violence, women are getting more violent, but they are so far behind males in violence that it's really acute missing of the statistics to say that women are becoming as violent as men, because frankly there's absolutely no evidence that women are ever going to be as violent as males. And that's what's happening. That is to say that the social vessels which have regulated aggression in both male and female are collapsing, and therefore, as young women in gangs, for example, have less effective female mentoring by mature women. They do what always happens in a patriarchal culture. They look at patriarchal values modeled by the powerful young male gangbangers, and they emulate that in order to gain status. This is not, doesn't take a brain surgeon to figure out what's happening there. So anyway, let me just talk briefly now about compulsivity and the archetypal press through these quadrants. And I just want to just talk about this briefly. There's a lot that can be said about this, but I just want to emphasize the difference between my thought and so much contemporary thought on compulsion and a number of other psychopathological patterns. What I'm arguing here is that to the extent, here's my fundamental assumption that we can elaborate and as we go, that each archetypal line of development is a huge challenge for the emerging human self, little s self. It's a huge challenge for the person to be able to draw upon that archetypal foundation in a constructive, creative way. Given our families, our cultures, our religions, our families, our birth order, the particular trajectory of trauma that we've experienced as persons, we will have been helped, blessed, or hindered and cursed in ways that affect the integration, the adequate integration of these potentials in our functioning self-system. Now, here is another fundamental assumption. To the extent that you have been able to take in this building block of a particular line of development, draw upon it in a creative way for your self-functioning, that sector will be less compulsive. It will be more optimally regulated and become less problematic for the person. To the extent that that particular sector has been cursed or ignored or neglected in the developmental process of the person, that sector of the psyche will be the locus of invasions, possessions, flooding, compulsivity. So what I'm suggesting to you here, for example, is that just as Kohut showed us that narcissistic pathology does not simply apply to narcissistic personality disorders, I'm suggesting to you that compulsivity does not just apply to compulsive disorders or addictions. That in fact, the narcissistic personality disorder is a compulsion. It is a royal compulsion. the individual, the person with a narcissistic personality disorder is not, you're not seeing their human personality. You're seeing a compulsive invasion pressing into their little s or ego space of this royal archetypal energy. Why? Because it has not been adequately related to in their developmental process. How do we know? Well, you simply look at persons with narcissistic personality disorders, and they did not have attuned mirroring. If they had had attuned mirroring in their developmental process, they would have developed self-esteem, more adequate self-structure, and they would not be flooded with this raw, primitive demand for mirroring. You follow? So in other words, what I want to suggest to you is that what we've got to do when we're thinking about psychopathological patterns and symptoms is we simply need to start being a lot more sensitive here. We need to say, where is the compulsivity? We know that the compulsivity is going to come not from something personal. The compulsivity comes from the impersonal power circuits in the personality, these archetypal quadrants. So let me run through this one time, and then we'll discuss it before we take our break for the night. Okay, I'll just finish with what I was saying there. If you are being flooded with royal energy from the royal quadrant in your psyche, you will be, your ego awareness and your little s self will be flooded with these demands for mirroring from others. You will not be into idealizing transferences at all. Narcissistic personality disorder cannot form an idealizing transference. That's why it's so hard to treat them. So the good news about being a Jungian in your approach to treatment is you can help people without them idealizing you. Although we've got a lot of Jungian analysts that demand idealization. But there's no, well, right, sure. Yeah, I mean, I'll say, clearly my narcissistic house is not in order. And I've had more analysis than any other living person. But in any case, I'll just say that, but the Jungian theory and its actual approach to therapy does not require any idealizing transference, because if they can dream, you can work with them. If they can, this is the catch, if they can stand to have you give attention to their dream instead of to them, you can help them. Some people are so narcissistic in the royal way that they're jealous of their dreams and they're envious of their imaginal products, and so they cannot stand for you to work with they won't bring you a dream. And the reason they won't bring you a dream is they don't want to share you with the dream. Do you follow that? So what do you do in that case? Well, you simply work with your presence, and you try to have a very modulated, calm presence, which is easier said than done. And I have found that you have to, we don't have time to go into this today. We can talk about it more tomorrow. But I have found that you really have to get good at communicating between the lines with a narcissistic personality disorder. They've got to be able to tell that you care for them without having to admit that they care. So anyway, so if you want to understand the compulsivity of the royal sector, you simply look at the phenomenology of the narcissistic personality disorder. This person is not choosing to be arrogant, my friends. That's what I'm saying. You have to understand that this person is not choosing to be an arrogant SOB. They have been invaded, or they were either invaded or they never were given the help they needed to exclude this huge energy from their self-sector, little less self-sector. If the parental environment was so unattuned, then they have never had a chance to push back the demands of the great self to have any space for their little human being. And so we could say that we have to crank up our empathy for how little space the little human in them has ever had because of the inroads of this great thing into their ego precincts. So that's the royal sector of compulsivity, and you can see that in differing degrees. For example, the histrionic personality disorder, you can see some of the inroads of this there too. Although it's not nearly as flagrant as in the narcissistic personality disorder. The histrionic wants your attention, and you can see the royal demand there. But their ego is not really centered in this sector. They've got a lot of this erotic stuff in them too. And in the erotic sector, there will tend to be a compulsive search for the gold outside. And passive dependent personality disorders and histrionic personality disorders are compulsively object-oriented. Even though in that histrionic, you can still see the bleeding through of some of this royal stuff. Because I don't know if you've noticed, but when a histrionic personality is recruiting you, there's a lot of demand in that recruitment. And like I never will forget the persons that would come to cocktail parties and would come up to me and say, "You're ignoring me, aren't you?" That's a typical histrionic line, said in half jest, but just half jest, and so you can see some of the royal bleeding into the histrionic too, but it's royal. It's a mixture of royal and erotic energies in a histrionic. In that the compulsivity in the histrionic and both the passive dependent and active dependent personalities is that compulsive overvaluing of the object, the compulsive experience of the center out there, not in here. And so let's look at the compulsive invasion of this line of aggression, warrior energy. To give me examples of manifestations of compulsivity around the invasion of the aggressive line. Feldman, give me an example of that. Verbalizations on others. That would be a kind of an invasion. The person has very little empathy, and one of the things you can tell if the aggression line is pressing in, there's very little empathy, and often very little awareness that the aggression is aggression. We find this a lot in people who perpetrate verbal abuse. Most of the people who are verbally abusive do not think of themselves as at all being abusive. They really consider themselves to be quite self-righteous. So there's a lack of awareness of the discharge of aggression. In other words, this is kind of unregulated aggression, but the ego consciousness does not recognize it as such. And the same thing is true about the kind of gratuitous aggression that you see in domestic violence. This is a bleeding through of this aggression sector of the psyche, and even in repeated patterns of perpetuation of domestic violence, the ego consciousness of the perpetrator is often very unaware of how much aggression is coming through their personality. Well, clear. I mean, I can't go into that's right. I can't go into treatment patterns about that in detail now, but simply to say that when you're dealing with that has to be confronted, but it has to be confronted empathically. That is to say, you've got to try to make an alliance with the human being in there, because you're dealing with a killer, but that killer is not a person. That's an archetypal force, and it is managing to dissociate the personal psyche. The psyche is in a state of dissociation in domestic violence. Perpetrators. This is what's not understood. And this aggression is really, in fact, one of the rules you can say is when the little s self, the human self, or the ego awareness of a person is being compulsively flooded by aggression, it is dissociating that psyche. And very likely, if you trace the history of that person, their very pattern is because they were victims of unregulated aggression. There's a lot of evidence for that. But unregulated aggression is almost always fragmenting. I would say it's always, in my view. You've got to see the treatment strategies in domestic violence. You've got to get out of assuming these are bad men, morally bad men. There's got to be a combination of very, very heavy stainless steel containment and confrontation with an attempt to make an empathic connection with the human being in there. And there's usually so much self-righteous rage on the part of the treatment team that they have very little empathic capacities to actually be in a treatment mode with the person. And so that is, I agree with the feminist that these individuals have to be effectively confronted about how destructive their unregulated aggression is. And I mean consistently confronted in a stainless steel vessel way. However, I don't agree with the treatment strategies that have become very popular around the country that dehumanize the perpetrator. And the truth is, these archetypal energies that are possessing them and leading to this unregulated aggression, that is not human. That's transpersonal forces, and they are as much, in some ways, the victim of that as their victims. But what I'm saying is the requirement of empathy in people who would be therapists is huge, and we honor it mostly in the breach, even when we're not dealing with domestic violence perpetrators. If it's harder to be empathic with anyone, if it's more difficult than with a narcissistic personality disorder, it's with a sociopath or a domestic violence perpetrator or a sexual abuse perpetrator. But what we have to realize is that all these individuals are being colonized by incredibly powerful forces that they have never been helped to develop a vessel for. And tomorrow we're going to be talking about the task of creating that inner vessel, which is required for anything remotely resembling a healthy self, little s self. When you get down to the borderline, you're getting to the place where the structure is very on and off. And so a borderline personality is a person that is all over these quadrants in a kind of a wobbling way. In other words, a borderline, I love borderlines. I think they are incredibly fascinating, and the reason is they are so close to the fire. There's not very much human self there in a borderline. It's very flickering. The human self-organization in the borderline flickers. It's more on than off, but it's like the flickering teleporter in Star Trek. And when you look closely at a fairly severe borderline, you're going to be real close to the angels and the gods and goddesses, and now you're going to see absolutely brilliant insights, absolutely transpersonally brilliant insights. Now you're going to see incredible transpersonal aggression coming at you, man. I mean, coming at you, intending to kill you and salt the earth that you came out of. And then you're going to have incredibly hot, erotic stuff coming at you, which looks at you and which sees how beautiful you are. And the borderline is going to see right into your erotic needs and they're going to see right into the place where your erotic needs are not fulfilled. And they're going to come right in there and say, and I can fulfill them. And then they're going to come right in there, and they're going to be able to see you in an incredibly loving and nurturing way. And it's totally unlike we stereotype borderlines. They can be tremendously spiritually prescient and incredibly revelatory. And you can hear the voice of God coming right from, Jesus coming right, the real voice, the real avatar coming right through that borderline. What you got to understand is that what you're experiencing is not personal. They are so close to the fire that they're just mediating all kinds of transpersonal energies a lot. And if you have the eyes to see, you can see the enormous beauty of the human psyche in the life of the borderline. And you can see what in some ways, what a grace and gift they are to the rest of us. Well, you acknowledge all the presences, but you try to form an alliance with that little seed in there of the emerging true self, which, contrary to the Kernbergs and the early Kohut and those people, they pathologize borderlines far too much. That is, a borderline has tremendous capacity for healing if they can find the right therapist who has some smarts and street savvy. A therapist to work with a borderline has to have enormous street savvy. You can't just be a cute professional therapist. You got to be willing to wrestle. It hadn't given up its ego. The borderline is not psychotic. They only fly close to psychosis now and then, and they're not really psychotic. And so you see, we've got to really watch this. The reason we really want to pathologize borderlines too much is that we're really, especially to the extent that you're not a little crazy yourself as a therapist, you are terrified of a borderline. And why are you terrified? You think it's because of their pathology. It's not. It's because that's exactly it. Because a borderline will present the numinous to you. And you're confronted with it. You can't ignore the numinous when you're with a borderline patient. It's a lot easier to ignore it when you're with a narcissist. A narcissist, you can just hate their guts. And kind of think you're self-righteous about it, But when you're with a borderline, the numinous is coming through there, and all of your little radar that says, angels and gods and everything are in the presence are clicking in. Even though you're a secular atheist, there's something in you that's saying, numinosity is here. And you've got, especially if you're a flatland secularist, you have got a huge, just like Lionel Corbett, a real smart friend of ours that's out at Pacifica. He used to talk about, and I think it's a very apt phrase, the defense against the numinous. And persons who are really sort of secularist flatlanders who don't really know anything about spiritual traditions, have never had any religious experiences that they're aware of, except on dope. Usually not very much, even when on dope. They're, what's that word we use when we're talking about the handicap now? What do we call them? Challenge. These people are numinously challenged. And so when they are with a borderline, they have to really pathologize the borderline, because if they don't, the borderline is going to be a medium figure for them. Yeah, that's such a crock of manure. That's malpractice in my view. That's malpractice in clinical education. Anybody that tells you cannot treat borderlines is totally full of it. And that's just sad, because, the mental health industry has been taken over by greed and money and money mongers. And you know what? You can't treat borderlines with brief therapy and pills. That is, you're not going to help them much. It's going to take a lot of wrestling to help a borderline. And not only that, you're going to, and we'll get into this tomorrow right before we stop. We're talking about sort of street magic for working with really sick people. And what you got to do is you have got to get out of, as a therapist, you've got to be in touch with the social systems in your city. And you have to be able to utilize every self-object milieu resource that you possibly can. That is to say, if you've got a borderline and they're not connected to a religious community of some kind, you have to figure out how you're going to help them choose a religious community to get involved in where being into the stuff they're into is not so pathologized. And I don't care if it has to be an alternative religion of some kind. I mean, I have seen, a lot of people like to run down the so-called cults. And they're a bunch of idiots as far as I'm concerned, because there's more practical psychotherapy done by minority religions in this world than is done by all of our mental health practitioners put together. And it has to do with providing community, a place to live, rituals which help to contain all that incredible, what's that we call it? We call it the, when you're really getting crazy along the magician line, it's, I'm blocking it now. Well, as Milan talks about it, you get crazy along these different lines and you start being a schizotypal, right? You're not schizophrenic yet, but you're schizotypal. Well, what that means is, you know what schizotypal means? It means you know about angels. If you believe in angels, you got a little schizotypal stuff, or if you believe in spirits and that sort of thing. And so if you can help a borderline find a context where they can have a cognitive framework connected to other people, which gives them a way of talking about what they know to be true. You see, they know that these entities exist. And they have been having their, what Adler called their own little private philosophy, their own private logic to explain them. Well, if you got a private logic to deal with angels, then you're crazy. If you're in a group of people that have a group philosophy to deal with angels, you're in a minority religion, or you're a Catholic, or a Jewish mystic, and it depathologizes it. So we'll get into that more tomorrow. But, this is back toward, in other words, the press I would make and do make about practical psychotherapy, those that really want to help people, particularly those that don't have enough money to do long-term analyses, is we have to use community mental health approaches like we used to talk about back in the early 60s. But we got to do it in a much more sophisticated way. By drawing on all sorts of resources to help people be grounded physically, grounded in relationships, grounded in communities, where they can optimize the levels of support they have to contain these energies that keep flooding in from the inner world. Let's see, we've got a few more minutes. Any other comments or questions about that? Let me just review, see. What I'm arguing is that compulsivity always is grounded in archetypal invasions. That archetypal invasions will always lead to dissociation and fragmentation in the personality systems, always. What we have to do in scientific psychology and psychoanalysis is we've got to stop oversimplifying things, and we've got to look at what we can know about the fundamental configurations of these impersonal forces that prey upon budding egos and little less human selves as they're struggling to learn how to regulate, so that instead of treating every patient the same way, we can actually do a real differential diagnosis and not just have it be a labeling, which is what it is now. Most of our so-called differential diagnosis is just getting the right label out of the DSM-4. It does not really have a dynamic grasp of what this phenomenon is. And what I propose is that we learn to do a structural analysis, which will actually tell us where this self is failing. Where is this self, this human little less self, where is it failing? Where is it fragmenting and why? What's its weakest link? Why is it collapsing there? Why is it vulnerable to invasion by archetypal contents in that sector? And then in our therapy, as we'll talk about tomorrow, in our therapy, we need to be able to give specific attention to the particular failure in the self-organization, so that, as we say in contemporary self-psychology, before we can heal this person in terms of a real integration of structure, a real structuralization, at least at the beginning we can help them find the right prosthesis, the right psychological and relational prosthesis, crutch, to help them function and not be destroyed while we work with them on actually structuralizing. Do you follow what I'm saying there? Now, that's what this is all about. Now, let me just open it up now, for we've got a few minutes. Yeah, go ahead, and then John. Well, see, that whole question is what I was addressing in that course I gave here on angels, demons, and spirit possession. It's important clinically, from a Jungian point of view and from my point of view as a structural analyst, to be able to distinguish between archetypal contents, which are what Jung called personally related and need to be integrated, as in a shamanic soul retrieval approach to healing. See, most therapies that have some dynamic insights are sort of shamanic in their model. They have the idea that you go out and you retrieve this lost part, like a Gestaltist do that way. Freudians, they want to reclaim things that are repressed or split off, and try to bring them in, and certainly Cohutians are into integrating things and trying to transmute and internalize all that fantasy. But Jung had an understanding that there were also psychological entities in the archetypal unconscious. And remember, you can't assume that they are external. You can't, as a psychologist, a scientific psychologist, you're not making metaphysical claims about whether they have an existence independent of the human psyche. As a scientist, you're simply dealing with what appears phenomenologically in the psychic realm. You have to bracket those ontological questions until you are willing to do your philosophy and take that on. But clearly there are archetypal entities, which I will share with you some tomorrow, which will come into the precincts of the ego that are not supposed to be in the precincts of the ego, and they're not supposed to be identified with. Some of these are benign, but yet still not supposed to be identified. For example, if you're a songwriter and you get in touch with your muse, or if you're an artist and you get in touch with your muse, often they project it on women friends or men friends, But if you start to identify with your creative muse, it will destroy you. You'll become an addict, because if you identify with creativity, you're going to die. I mean, that's why there's so much death among creative artists, and why they have such a bad time surviving. So that's a benign, but you don't want to try to integrate it and merge with it. And there are archetypal entities, I've done a lot of this in my lecturing on evil, which are not personal, and which are very toxic, and which create a lot of compulsivity. Remind me to talk about this tomorrow. I think a lot of suicidal ideation and a lot of compulsive suicidal behavior, I do not think that's personal. I don't think that's personal at all. I think that's transpersonal. I think that's an invasion of some of these very toxic spirit complexes. And I think that one of the most important things to do with suicidal patients is to really confront the necessity for them to distinguish between their true self and this voice that is telling them to kill themselves. Because the true self will never tell a person to commit suicide unless they are dying of Lou Gehrig's disease or something like that. And you can see some life-affirming suicides in terms of terrible illness, terrible painful illness, but most suicides are not that. Most suicidal persons that are really suicidal are having compulsive voices and urges to kill themselves. This is not personal, in my view. This is an example of what Jung called a spirit complex that's very toxic, and you've got to get the person to disidentify with that voice. Say, this is not you. You have to fight that. You have to fight that. You have to fight that. That's trying to kill you. And even the British object relations theorists, who are as atheistic as they can be, and they're not Jungians at all, they don't care about that at all. They see this thing, and they talk about that as the antilibidinal ego. And in other words, there's an I in the psyche, which is not the true self, and it wants to kill you. And it's very important. We should come back to that tomorrow. Well, see, that would be one way of spiritually of talking about this kind of thing. But anyway, so tomorrow we should come back to that. And remember, I asked you to see if you can think of a dream that you'd feel comfortable sharing that might show some compulsivity, either a dream of your own or a dream of someone that you have permission to consult with others on. We'll keep this confidential. And think of any clinical vignettes that you'd be willing to share where you've observed compulsivity, and then we'll try to talk about it, and I'll try to help you think about what's going on. But we will spend the first part of the morning talking about patterns in clinical practice that you may be able to observe in dreams and so on. And then after our break, we'll talk about strategies and integrative psychotherapy, and I'll just talk about a little bit more about the difficulty that occurs because the therapist is too possessed by the magician, and why it makes us less effective as therapists when we're too possessed with this magician fantasy of our being the great magician. We're the great wise ones, and this cripples our ability to help people. And then finally, we will talk about more about what I say. We've got to do structural diagnostics in order to optimize our effectiveness. And then we'll talk about some of these integrative interventions and what an integrative intervention is. And in my view, we have got to go back to the community mental health models, but do them in a much more sophisticated way, picking up on what we now know about ritual processes that we didn't know then, and the positive importance of ritual processes, of humor, of other kinds of resources that, in other words, the optimum utilization of adjuncts to therapy, getting to the point where you're very clear that you are not the therapist. You should be someone who orchestrates this healing process. You're more like a conductor, or you're more like someone who mentors a healing process once you get clear on what's really wrong. Because my understanding of this is that it takes a whole community to heal a person, and healing is a processual thing. It's not a state. And what we've got to do is to get much more sophisticated in ways that we can mobilize communities in such ways that they're able to deploy themselves for helping people regulate. You follow me? So we'll talk about that a lot more tomorrow. Well, I think it's very interesting if if you're doing supervision or you're working with people that are working clinically, and you become aware of this kind of material. Dissociation is a lot more common than standard discussions seem to think. Standard discussions kind of like, think that whether these people dissociate, and then there's the rest of the spectrum. And this is really what I'm talking about, because there's a dissociative thing that's going on with all these patterns, and to the extent it's compulsive, there's some dissociation going on. Because you need to read dissociation, you need to read that as a failure of the vertical integration in the psyche, the integration of systems in the psyche. And that is to say, dissociation simply means, from a Jungian or neo-Jungian point of view, it simply means that the complexes are more autonomous than they need to be. And there needs to be a golden thread sewing those complexes to each other so that there can be communication between them. And so you're describing a very subtle thing clinically that happens if you're looking in the eyes of someone who is dissociating in a severe way. Often you can tell that there's more than one presence in the eyes. And there are a lot of people that talk about this, but if and it's very important to be able to acknowledge all those presences. And this is like working with multiples, because even if it's a presence that should not be integrated, which I've lectured on before, what Jung called the spirit complex. You need to acknowledge in your own experience its presence, and that's all of these presences in the psyche have to be addressed one way or the other in the process of healing. And you can listen to my lectures on angels and demons and spirit possession, where I talk about that. But the important thing to know is that to the extent that the human little s self or ego is in trouble, there is dissociation present, and there's compulsivity present. And what is our job? Our job, in my view, if we're not to be charlatans, we have to be better at doing structural analysis of what the nature of the dissociation is, what the nature of the compulsivity is, and how it is structured. What is its source? In other words, a compulsivity coming out of the royal sector is totally different than a compulsivity coming out of the magician sector. Let me just comment on that magician sector. That's the one I know the most about, because that's the one that I've struggled with the longest in my whole life. In that magician sector, but the compulsivity in the magician sector is so easy to miss. It is so easy to miss, and it's so present in the therapeutic community. That is, the compulsivity of the magician archetypal configuration. What does it do? I've lectured on this, and it's in my books. You can see it, but it's like, if you look at the diagnostic manuals, it presses compulsively towards schizoid and asocial patterns, the schizoid and avoidant patterns. And so anytime you see somebody that is escaping into their introversion, what you're seeing is a compulsive phenomenon resulting from a archetypal magician presence that is invading the ego sectors of the psyche and pushing it into isolation, and pushing it into overvaluation of mentation, cognition, pushing it into an overvaluation of intellectual pursuits at the expense of all other pursuits of the personality, and pushing it into overvaluation of so-called esoteric pursuits. And you can see this a lot in our tribe, our Jungian tribe. I mean, it is so easy to get into mental worlds and to assume that because you're into the mental worlds that somehow you're spiritually superior and esoterically enlightened, when in fact what you are colonized by the magician archetype. And we have got entire traditions of spirituality which portray themselves as being illumined, when in fact it's really possession states, and which drive people out of relatedness, that drives them out of a concern for the world, it drives them out of a concern for the body, it drives them out of a concern for the public sphere, and it's really it's easy to miss if you're into psychology, because if you're into psychology or psychotherapy, either as a profession or as an interest, you got a lot of this magician thing in your personality anyway. And if you get strokes for it, as in certain of our circles we do, although not all of them, then you get attention for manifesting these magician agendas, and it's very easy to be encouraged by the strokes you get from folks to go further into the magician rooms in the psyche and become further colonized by that archetypal structure. Now, what happens to you when you are? Well, you become less aware of how aggressive you are. You don't notice how you hurt people. You become less aware of your power agendas and the way you use your power, and you project that on other people. And you become less aware of the erotic overtones of your magician involvements. So I'll get into that more tomorrow. But anyway, the magician archetype comes in compulsively into your ego precincts, and it sets up shop, and you think you're it. And, this is the Jungian analyst that portrays themselves as the great magus, and mystifies their practice and their personality, and demands a magician, idealizing magician transference from people. We see this in training a lot in training institutes, where if you're a candidate in the Jungian Training Institute and you do not bring an idealizing magician transference to your training analyst, then suddenly you're a borderline and they don't want you in the program. Well, you should be, because I'm not kidding you. It is disturbing to me how much mischief goes on in Jungian training institutes because of a lack of consciousness about the way in which this magician archetype colonizes all therapists and all psychoanalytic institutes without regard to school. And the power, the abusive, sadistic power agendas of the training committees of all these, just like graduate school, except worse. And so I just wanted to point out that what is portrayed as great illumination and erudition is a possession state. Very schizoid, very unrelated, very disembodied, sadomasochistic compulsion. And if you study at the Adler Institute or the Institute for Psychoanalysis or the Jungian Institute, it doesn't matter where you study, it's present in all of these psychological training institutes and the schools of professional psychology. It's very much present there too. It's no less compulsive than a compulsive personality disorder. No less compulsive than a narcissistic personality disorder. It just looks more acceptable. Yes. Huge. Okay, she's saying, what is the relationship between inflation and compulsion? They go together. That's what I'm saying today and tomorrow. That any time you have got an archetypal presence that is not being related to consciously with a sense of humor and some grounding in your human life and in your human relationships, to the extent that you kind of get isolated by that archetypal content, it is going to inflate you in Jung's classical language. You're going to be inflated. You're going to be grandiose. And to the extent that you are, it's not a moral problem. It's not your moral problem. You're a victim of a colonization, a psychological colonization by an archetypal presence. And you will be inflated, and then you will be compulsive in the way that thing structures your life. It's not you structuring your life. The archetypal configuration comes in and structures your life, and you think you're doing it. Now, this is what you've got to get your mind around. In other words, psychopathology is not near as personal as our schools of thought think it is. It is very impersonal, and it's pathology precisely because it is impersonal. It's archetypal. Archetypal doesn't mean good. It means flat. It means one-sided. It means this is what it does, and it doesn't do anything whole. The royal archetype, if it moves, it nurtures it, it blesses it, or it dominates it, depending on the form it takes. The magician archetype comes in. What does it do? It interprets it. It detaches from it. It looks at it. It is a voyeuristic position. That's what it does. It doesn't relate. It doesn't build. It doesn't love. It does what it does. The warrior configuration comes in. What does it do? It organizes. It makes it linear. It gets a project going, a mission. It's laser-like in its concentration. It doesn't relate personally. It doesn't have any personal values at all. It's work. It work. It's into work, completing the management by objective, and it doesn't care a hang about who gets in its way. It's going to roll right over them. If it's really regressive in its form, it's violent. Verbally violent, physically violent, or intellectually violent, whatever. It's just when, yeah, sure. Right. I mean, you can see this in the active, in my course that I gave on the collective unconscious and psychopathology, I took Milan's categories in DSM-4, and it talked about the active and passive independent, the active and passive dependent, the active and passive detached, and the active and passive ambivalent, and showed how they're related to these things. All I'm emphasizing this weekend is these things are compulsive. Let's get clear. Compulsion is not one little problem. All psychopathology is compulsion. What is the question? What sector is it in? Why is the person compulsive in this sector? Because they're not related consciously to this sector of the archetypal ground of their self-formation. Yes, the way I think that Milan is right about the way he conceives this. Look at the latest edition of that old modern psychopathology book, and look at the way he organizes this in terms of it. You know, you look at this in terms of relative integration to lower and lower levels of organization in the personality, and so from healthy integration, good enough cohesive self, then you move down to neuroses, you know, what we used to call the neuroses and personality disorders. Then as you get into more loose organization, where you don't have a dependable structure. You see, a neurosis or a personality disorder, or even a narcissistic personality disorder, is a relatively dependable structure in the psyche. It's not balanced, but it's a relatively stable structure. Well, welcome this morning on this nice rainy morning. Our host said this was a good day for soul work. So what we're going to do before the break this morning, we're going to try to take our break at about 11:15. Before the break, I want to invite all of you, because all of you have some kind of clinical involvements, relationality involvements, and I also want to invite you to raise any questions around your own struggle. I'll give you some examples from my own struggle with this sort of thing, so that we can welcome any personal stuff related to our own therapy, if you like. But anyway, we're going to turn the recorder off until the break, and then after the break, I'll come back and we're going to talk just about clinical vignettes, recognizing the marks of compulsivity, and share any clinical vignettes you want to share. And then I invited you to bring any dreams that you think might illustrate some of these dynamics. And then we'll take our break, and I'll come back and we'll be talking about strategies in integrative psychotherapy, because we did say that we want to talk some about healing these things. So we'll be talking about strategies in integrative psychotherapy after our break. Well, let me comment on that for the tape. We've just begun our discussion of strategies in integrative psychotherapy based on the structural analysis. And one of our class members was just saying that as she has worked on trying to integrate her aggressive systems into her self-system, the warrior function, she's found it very helpful to make sure that she's trying to bring that into relationship. And she feels that is her way of developing membranes which help her protect herself. And I think that's a very, very good way to think about it. In fact, any of these systems need to be brought into embodiment in relationship and community. As we go for the rest of our time today, we will be talking about that community dimension and relational dimension. That has got to be a part of any serious attempt to integrate these systems. I said yesterday that I would just say a little bit more about the shadow of the healer, and I want to give you a reference that until I can get this stuff published. There's an essay in a book called Healing and the Healer, edited by George Cairns, C-A-I-R-N-S. And I published this thing called The Self and the Shadow of the Healer, Perspectives from Structural Psychoanalysis, as a chapter in that book. And in that, I simply talk about the way in which therapy as a professional kind of function has developed under the aegis, under the image of the magician archetype. And most therapists have not done any kind of archetypal studies. Therefore, they don't really understand the power of the image that they're operating under and the way it controls the therapist and the process of what happens in therapy. In fact, if you will look
at the way in which Freudians conceive the therapeutic process, the transference, countertransference relationships, their fantasy of abstinence, their fantasy of clean relationships between the analyst and the analysand. The professional model picks up on this and really emphasizes how you must not have any real personal connection with the people you work with and so on. If you study the professional model of helping professions, and you look at the classical models of containment in psychoanalysis, you really see the way in which the magician archetype is just running rampant in their conceptuality, and they don't really know what it is. They don't know what the magician archetype is. They don't know how it dominates them in an impersonal, compulsive way. And it dominates what they can do in therapeutic intervention. So the very idea of having a person being in therapy with a person who cannot see you is a radical magician move. To have them that they can't see your face. That's a radical magician move. That is to disappear from the view of the person you're trying to help. It's also a radical power move. And in the shadow of the magician, the dialectical shadow, if we look here, if the magician, if we're talking about the face of the structure of the self, that's the magician, and if this is dominant, what is dialectically across from it? It's the royal, the power agenda. And since in a therapist, I'm not trying to have power over you. I'm really abstinent. I'm just really sitting here taking notes. I'm not into a power trip. I'm not being, the Freudians have this incredible fantasy of how by being in this invisible place that they are not influencing the environment, which is ridiculous. This is really a ridiculous joke. It is so unsophisticated. How could anybody make such an unsophisticated assertion if they were not possessed by an image? All the studies we've got show that everything is an intrusion. Everything you do is an intrusion. If you don't have any pictures on your wall, that's an intrusion. If you have pictures on your wall, that's an intrusion. So you're going to be presenting. There's a form demand to any way you present, and anybody that thinks there's not is just I can't help them. But anyway, so you got this power agenda here. This power agenda. Well, if you're so dominated by, if you've got an obsessive preoccupation with some theoretical dogma, that cannot be discussed, which is what happens in these circles. But anyway, look at the power agenda here. See, that's the power agenda. And to the extent that you're just retreating into this magician thing, you've also got aggression and erotic agendas. And if you want to know why there's so much sexual acting out on the part of therapists, it's because this magician thing is so dominant. Because if the magician thing is really that dominant, that means that you are not aware of how aggressive you're being, and you're not aware of how erotic you're being, and you're not aware of how much into a power trip you are. And so you can actually see the impersonal structure of our profession and the way in which so much sadomasochistic abuse of clients, both in acts of commission and acts of omission, which gets me to, the thing that Nell brought up yesterday about the case management model. That is to say, a therapist that thinks they're superior because they will not think about mobilizing resources on behalf of their client or analysand is sort of possessed with the magician archetype. The idea that you somehow ruin the therapy if you seek to mobilize other adjunct resources for the healing process is an amazing detachment fantasy. I'm not in community with you. When we terminate, you will no longer exist for me. That's that kind of fantasy. So in any case, look at that essay, and I've just kind of barely scratched the surface in that, but it's something that if we thought about, it would expose a lot of the dynamics of these crazy dynamics in these training institutes, because it would say to our our analytical colleagues, look, you have to get conscious about your aggression and manage it, regulate it, and stop retreating into this magician persona and melding with it, you know. So let me just talk now about some strategies. First, we've been talking about structural diagnostics, and this weekend we've been talking about compulsivity, which I'm encouraging you to become more aware about when you're doing reflection on your cases, whether it's the case is you or whether it's someone else. And so let's just take a few moments and let's talk about the marks of compulsivity. And when you when you notice compulsivity, what are some of the flags that have been helpful to you to notice when compulsivity is present? So let's just say from your own practice, from your own work with yourself, how do you know when you're being compulsive? And how do you know when somebody else is being compulsive? So let's just open it up and let's just get a few of these out on the table, because it's not, this is not rocket science. I mean, you see what Nell is saying. She's describing in a certain sector, certain type of personalities. She's speaking of people who are dealing with addictions. Now, in my work, I view addictions as the clearest example of the flooding of the lover sector, compulsivity in the lover sector. And she is describing something that she's noted phenomenologically about folks that are having trouble getting this flooding lover energy contained. Understand, lover doesn't mean it's good. Love and death are in fact closely related. Woody Allen was right. You can fly right into that flame and disappear. So she's noting, though, the inability to act. Now, ask yourself, what is structurally dialectical to the lover? It is the warrior. It is the capacity to act. There's only one source of focused action in the structure of the psyche, and that is in these warrior systems. They are about doing. They are not about being. They are about doing. And so even a person with a lot of royal energy that is really crippled in the warrior, they cannot act. So what she's showing us is a clear expression in her own experience of the dialectical shadow of these people. They are out of touch with those action circuits right now, and they are that way, not because they don't have them. And those people that say they can't be helped, you see, that is ridiculous. These systems are in the psyche. We know they're in the psyche. We know that the aggressive systems are in the psyche. We've got neurophysiological evidence that these are clear systems, and they're either online or they're not. And if the person is not brain dead or have a massive organic brain syndrome, these systems can be brought online again. The question is, how do you do it? You see, yeah. But the problem is that the human person that's aggressive, or is that something else? Yeah. What is it that she's wedded to? She's talking about a person who's a compulsive victim. Now, do you see she's describing the way a person who is kind of in her conscious mind seeks to center itself in terms of this kind of masochistic pattern. But we notice this fury that's coming in trying to compensate that, see? But one thing that this whole axis is not structuralized, because we're getting raw, primitive, erotic stuff in the masochism, and we're getting the raw dialectical shadow coming through in the rage and the fury. So you got a real challenge here, because this person is operating in a very this is very overheated dialect. Okay, now just in terms of practical psychotherapy, if you've got somebody that is flooded with the lover erotic energies a lot, whether they're depressed, whether they're addictive, or whether they're in a victim pattern like this,
Um, what is the most effective strategy to try to start containing this? Is it putting energy into getting them more into lover energy, or putting energy into getting them more into linear space? Think. Is there any way to fix the lover problems of this person by addressing the lover sector? No. Do you understand what, do you see this? You cannot fix the lover sector on its own. Why can't you? Because it's formless. It is the essence of unstructure. It is a solvent. You cannot build structure in the lover sector alone. It has to have containment by the other aspects of the psyche. So in terms of practical psychotherapy, you've got to understand this, because if you don't understand this, you will end up as a therapist getting her into catharsis, encouraging her to talk about her victimization, encouraging her to talk about her abuse. Do you see this? A lot of therapists don't understand this. A lot of therapists will think they're being helpful if they go with the person into their pain, go with the person into their abuse, recount the abuse again, recount the victimization again. The therapist, many of our therapists, I tell you, if we did a survey and it was honest, if we had an honest survey of therapeutic techniques in the United States, you would find an incredible number of therapists that assume that the way you deal with unstructured lover problems is to get them more into their feelings. That is wrong. It is malpractice in my view. And so what the only thing you can do, well, see, it's like if I am flooded with lover stuff, I'm going to try to merge with you. I'm going to try to get you to be in my mishigas. All right? You're going to just come in here and in the hot tub with me, right? I mean, get in here in the smelly stuff with me, and let's just merge in the pain and suffering and in our little bath here. Well, that is not going to help her. And the therapist needs to understand that in this kind of situation, you have got to find a way. First of all, you have to be doing your own royal work so that you can be calm. Because it's very important for you to be able to be calm, and for this person to understand that you're not afraid, that you're not anxious about this. So that's an important thing, and that's your own centering work and all that. We'll get into that more in a minute. But in terms of intervention, the way to intervene most effectively with this person is not even through interpretation. So that's a magician thing, and the magician thing doesn't work effectively with this. What you've got to do is to be, am I a behaviorist? You bet. And all therapy has got, if it's not a joke, it's got to have behavioral elements. And so, especially with a person that's having lover problems, you have to mentor that sector of the psyche which can operate linearly. Because if it's a lover person, they do not operate in linear time. You have to understand, they are not in linear time. Now, that's hard for you to get your mind around, but if you study these configurations as I've presented them, you can get a feeling for this. Lovers are in eternity, not time. You follow me? So you must understand that these archetypal configurations have their own view of time. They have their own view of body, world, others, everything, and they're discrete. What you got to understand is, I'm telling you, these things are discrete, and you can learn to recognize where a person is by how they talk and how they present. Yeah, go ahead. Okay. So how do you get a person in linear time? Well, you focus on helping them with you. You serve the self-object function for the efficacy needs. Taking up Wolf's work there. In other words, what is in that warrior sector that you're going to have to help them with? Well, if you look at the self-psychology way of talking about this, which I think is accurate, I believe that Ernest Wolf is probably the greatest living self-psychologist anywhere. And his work, which I want to recommend, He's been my wife Margaret's teacher of all this stuff, and I've learned it through her. But anyway, the book called I think it's called Treating the Self. That may not be right. I have to think about that. But anyway, it's the book where he goes over his declension of this stuff. And you got the efficacy systems, the aversive systems, and the adversarial systems. The aversive stuff, you got to help this person be clear about where she needs to form boundaries. And instead of just talking about forming boundaries, you have to break that down in incremental behaviors. See, you've got to be the most radical behaviorist with a person like this. And you've got, it doesn't make you not analytical if you understand what you're doing. I mean, because what you're doing is you're trying to evoke you're trying to boot up this warrior system. Just like on a computer, you're trying to boot it up. It's not booted up. Well, she is trying to find the aggression. You got to understand, a masochist doesn't really want to be hurt. You got to get past that. The true self of a masochist does not want to be hurt. You're dealing with impersonal forces. The impersonal forces in the psyche it's an enantiodromia. It's not personal. This person is not wanting to be hurt, but they intuit that there's this big hole in the psyche which aggression is supposed to fill. Well, that would be, yeah, but I wouldn't jump to that. I mean, that might be true, but I wouldn't jump to it unless I had evidence for it. In other words, you have to stay with the structure of the particular person you're dealing with, and don't assume presence of archetypal configurations that are not evident to you. And the trap you see with such a person would be to spend all your time in the therapy simply interpreting. Her problem is not that she does not know. See, this is not a problem about knowing. It's a problem about doing. And it's only after she gets help from the self-object therapist, the therapist as sort of transitional self-object, you can help her boot up I've said the aversive first, that's the boundary, the adversarial to understand that she needs to pick her battles. And you have to help her figure out what battles to fight when. Because see, if you're in a lover space, all time is simultaneous. And all battles are simultaneous if you're flooded with lover energy. In other words, you can't organize. You can't organize your treatment plan if you're in that lover flooding. So what you as the therapist have got to do is to pick up and offer a self-object function where, in other words, here's a fundamental strategy that I argue should be followed in integrative psychotherapy. You need to figure out where the largest structural deficit in the personality is. Then you need to try to mobilize yourself as a self-object to help boot up the system that will help this person get most organization in the least time. So I'm suggesting to you that here you're having to be the most effective and in both structuralization and in time brevity will be for you to serve as the warrior self-object who can help her choose battles, get into linear time, and ask the question, what does she need to do to become effective in her life? In order to do that, she's got to ask what she wants to do. Now there's where you're getting into you begin to serve as a royal self-object too. Most of your clients that are real regressed cannot imagine what they want to do. You follow me? Because they are like that old thing, they're up there in the swamp filled with alligators trying to drain it, and it's awful hard to keep your mind on what you're trying to do if you're fighting off alligators all the time, if they're crisis dominated. So are you following my strategy? See, now what we need to do, now I'm just talking about street magic here. I'm talking about basic, fundamental, integrative psychotherapy. I'm not talking about loop-to-loop analysis, although this is relevant for analytical work. But until you help a person create a functioning self-system, you're not going to be able to do analysis with them anyway. Because if you start getting them more insight, they'll get crazier. Here's the thing, you got to understand, insight disorganizes. Do you understand that? Insight, information disorganizes if there's not a self-system. Does everybody understand that? So this whole approach that therapists use, the thinking that insight cures, insight doesn't cure. Structuralization cures. And you've got to decide how much insight can this person stand at this particular moment in their journey. You follow me? That's a fundamental assumption that you have to have in integrative psychotherapy. Because what are we concerned about? Fragmentation. Why is the fragmentation occurring? Because there's not enough structural integrity in the self-system. So what do we need to do in this particular person? We look and we see how she's being flooded, and we move immediately to the structural element, which is least functional. And I would say I know it's least functional because it's dialectically the polar of the thing that's flooding her consciousness. See? So that in that particular case, that's the way I would proceed. Now that doesn't mean that I wouldn't attend to the other sectors of her personality, but I wouldn't fool with that until I had gotten her engaged in linear time and break down. With a person like that, you have to break down everything into extremely incremental tasks. And then you have to monitor. This is just basic behaviorism. You have to monitor whether they have done the task. And if they can't do the task, you break it down into a smaller task. And then you come back and you monitor it. And with a person like this, you've got to be careful about having too frequent sessions, even if you can see them more frequently. One of the big mistakes a lot of therapists make is they see loosely organized people too often. I know of a case where there is a therapist seeing a very, very disturbed person, and this therapist is insisting on seeing this person 4 times a week. That's terrible. That's terrible. And the way you get my drift. With a person like this, this person is very regressed. You don't do things that are going to regress them more. And that means that you don't spend a lot of time with dream interpretation. That regressed. Until such time that you've got a behavioral program going on. Okay? Do you see why I say what I'm saying? Because I want you to understand the principles, not just the case. Okay? Now, now if you had a person flooded with aggression, you would reverse it. And you would begin to start trying to find the part of the personality that feels vulnerable. And you would go very carefully. Because if they're flooded with aggression, there's a tremendous amount of vulnerability. And you're not going to be able to get big insights into it quick, or you'll make them leave. So structural diagnosis and structural interventions go together. The key thing that I think is important here is having a basis for a treatment plan, and an incremental treatment plan where your goal is to serve as a self-object function in the least developed structural system until such time as they can begin to have some prostheses. We want to provide structural prostheses for the person until they have the time they need to internalize and metabolize those archetypal foundations. So in other words, if I am very weak in the lover thing, I need to have some strategy whereby I can participate in that erotic world without having to be the sole vessel for it. I need to be able to find ways to familiarize myself with that sector of the soul. And I need somebody to mentor me in that, see. So you've got to set up mentoring processes, see, for these sectors that are undeveloped. Now let's see. Yeah, go ahead. And what happens when you take too much responsibility? Then you don't do it, you see. Now notice, he's saying in trying to develop his own lover side in a conscious way, that he does not, let me translate that into technical terms. He does not put enough energy into finding a person who can serve as a self-object function for him there. Because until you get something consolidated into a structuralization, you can't do it by yourself. It's fascinating. In my psyche, my warrior functions are not nearly as good as they seem in my persona. Not nearly as good. And I find, as I've gotten to more and more insight into my shadow around these things, it's like I'm fascinated and horrified by how much I need the warrior self-objects in order to feel that sector of my psyche. You can feel it. And so I can see in my own work how much I've got to really kind of concentrate on this type of thing. See, I'm something like your client. See, in that respect, I need to incrementalize, I need to monitor, I need to carry through, and so forth until such time that I feel more comfortable in that area of my psyche. So I think this is a rule. It's not healing to know what you need to do, but not be able to arrange the self-objects and the prostheses that help get you into that, because you're just overwhelmed by it. And one of the ways you know there's no structuralization in a sector of the psyche is it's overwhelming for the person to enter it by themselves. So let me just lay this out now briefly. I'll just put this up so that we can think about it, because we've been doing exactly what I wanted to do in terms of thinking about this. And so an integrative treatment plan, especially, if you're working with people that are really ill, I mean, are really, really struggling, but I would say it's true for all of us in our own personal work too. You need to have cognitive intervention. You need to have behavioral intervention. You need to have interventions that have to do with embodiment and relationality and play. And you need to have interventions that on that royal sector have to do that will include this. They will include centering meditation of some form, explorations of devotion, and ritualization. Yes, all this is royal here. Agonistic for struggle, and this would be called this transformational magician agenda here. Devotion, ritualization, centering meditation, and service. And you can see here where community comes in these, particularly in those. Well, let's put it this way. I'm just putting up that when you're working on a treatment plan in integrative psychotherapy, you need explicitly to address each of these self systems, the systems in the self that need to be structuralized. And but you don't, depending on the person, you give more energy to different ones. But all of them need to be. You need to know what you're doing on each of those aspects. And so for the magician agenda, you've got to have some sort of conscious cognitive work. And even in that case where we're working on a person that's very masochistic and we're going to do a lot of behavioral intervention, there's a teaching function that you're doing with this person. You're trying to help them understand that the areas where they cannot function yet. It's very important. One of the typical things in loosely organized personalities is that they will present more their persona will present a level of function that's higher than they in fact can actualize. And what you've got to do is to help the individual in a supportive way understand some of the areas where they're having trouble getting it online. And that's a teaching function. And we can call that interpretive. There is an important aspect of interpretation there, but you've got to make sure when you're doing these cognitive interventions, which always ought to be done, that the intervention is not disorganizing. Every intervention ought to be organizing, not disorganizing. And so if you're asking a question, how do you decide what to say and what not to say? Well, a lot of, you don't want to say everything you know, because a lot of it would be disorganizing. You want to focus your interpretations on what you know based on your structural assessment of what will be most helpful in organizing. So if you're saying to this person, one of the things that's clear to me that you're having difficulty in breaking your task down in doable increments. Now that's an interpretation. And if you work together with her, she will become aware of her struggle in this area. And it will be less overwhelming, not more overwhelming. It'll be less overwhelming if she realizes that not only do you see that she needs help, but that you've got a plan about how to help her, and that you're going to be an adequate, maybe not a perfect, but an adequate self-object in that task. So you've got the cognitive interpretation, but you want to make sure your interpretation serves structuralization and does not add fragmenting energies to the self-system. And that is a rule that applies to all therapy and analysis. And it's not, for example, refusing to do any interpretation, as some therapists do, that is disorganizing as well. And the therapist needs to take some responsibility for the things that they do that create iatrogenic fragmentation, that is, fragmentation caused by the doctor. And then I've said that the second is the behavioral systems, which I've talked about as agonistic. That's the Latin for struggle, for the ability to struggle, really to deal with conflict and struggle and the ever-present conflictual dimensions of life. And so the struggle for adaptation needs to be approached behaviorally. I mean, you've really got to help a person get into linear time, and you've got to, particularly with borderline personalities, it's extremely important to help them get things very, very manageable in size, because they often present as more capable of functioning than they in fact are. And then on the erotic line of development, you need to have some attention to how they are addressing their embodiment. And it doesn't have to be hugely sophisticated. I mean, but you need to be addressing their relationship with their own body. And even in terms of addressing health issues, it's very appropriate for you to address health issues, physical health issues with a client, to make them aware that they have a body, because a lot of these folks are very, very, they're sort of dissociating from their body awareness. And for you to help them become more aware of their body and their diet, is tremendously grounding in their body. And to the extent that you can help them get grounded in their body in a conscious way, that will be very structuralizing for them. For them to begin to think about their diet. That also helps them with linear thinking. It begins to help them kind of understand that there are so many meals, and be more aware of that. The addressing what a person does for play and leisure. See, that's in the garden sector of the psyche. And if a person is it's very interesting, even if they are flooded with lover energy, you can't assume they know anything at all about play. In fact, they may be so depressed or so addictive
that they cannot address any play agendas. And so it's extremely important to ask and plan with them, help them serve as a self-object, helping them deal with, leisure activities. And you can see how that's related to behavioral approaches as well. Now, these royal agenda, your treatment plan needs to address this. That is, what sort of techniques are you using? They're euphemistically called stress management. But it's really more important than that. That is, doing work with a person, teaching them how to do meditation, centering meditations. You're really creating a center point for them so that they can actually experience in the body some calmness. And a lot of people kind of think that is really about the magician, but it's not really. It's really about the center point, the taproot, the axis mundi, and that's a royal image. That's the throne room and the archetypal palace. And so getting them into centering prayer, I don't know whether you know about centering prayer, but there are a lot of different techniques. Not all meditations are centering meditations. You got to make sure it's not a meditation which revs the person up. It's got to be a meditation which brings them back to the center constantly brings them back to the center. That the devotional part, see, there's where religious communities come in. The capacity, what you're really working on there is helping them with their idealization. And if you've got someone who is having terrible problems with idealization, then being a self-object with them, helping them to reflect on what way they could learn to admire someone or something, and if they have availability of a religious community, some of them do, some of them don't. You want to see if they can find some way to experience adoration of an idealizable object, self-object, and that can be a mythic self-object. For example, if you're dealing with someone who is an extremely secular atheist, a doctrinaire atheist, obviously you're not going to be able to use some overt religious community there in the short run. But this is where active imagination techniques come in, because you can work with them in imagining mythic figures that they could idealize. But you want to work on the adoration, because one way to help a person modulate their grandiosity is to help them develop an internal object representation which can carry some of that grandiose energy. I've had a lot of people do active imaginations with royal figures, and that, even with an atheist, you can get them to play an active imagination with royal figures, and relate to royal figures in the active imagination, and that is a very effective way of addressing this royal system, getting it working. Then you've got the external, depending on depending on the person's level of function. Service activities can be really helpful in this royal line, booting up that royal line. And increasingly, those of us that think about this stuff are aware that if you go down to a homeless shelter and serve food for an hour or two, there are a lot of positive benefits from that for the person that's doing it. And a lot of them are in this royal sector. Although not all, but a lot of them are in that. So service activities, and then as they get higher functioning, helping them to envision their leadership. If they are low functioning, you're not going to be able to get them to think about their leadership potential. Wonderful thing. It is so it is so creative. You can simply lead them on an active imagination, and tell them that they will meet a royal figure, and they will have to tell you, yeah, right. Now, if they're Celtic in their origin and they're really into Celtic tradition, you can let them use a Celtic figure that they know of. But active imagination is very helpful. You can use active imagination with any of these sectors at the right time, but you want to make sure that active imagination is not disorganizing. It's not going to be disorganizing for them. Some people, one person came in to me and was doing like a couple hours of active imagination a day. That's much too much, very disorganizing. And so you have to limit how much imaginal activity a person does, especially if they're in a real struggle. Now, so anyway, so what I'm saying to you now is very straightforward and simple. If you're working on an integrative model, there are a lot of people that think they're doing integrative psychotherapy that are not, because they are not addressing these different sectors in the personality functioning. They say they're doing holistic psychotherapy or integrative psychotherapy, and they're really basically working in the magician sector, or they're basically working in the feelings, and that is simply not really an integrative approach. So let me open it up now. We've got some time now to discuss any other insights you have about this. The hero imagery is really that's really a sort of an immature warrior imagery. It is the royal stuff in the hero is unconscious. It's like the grandiosity of the hero, is in all the hero myths. The hero is inflated, and they're going to have a nemesis. They got hubris first, and then the nemesis is going to get them. And so the hero is kind of a warrior who's not gotten conscious on what's worthy of serving. And so he serves himself. He serves his own agenda, and it kills him. The idea, that's just why that devotional aspect of the royal sector is important. If you're real narcissistic, for example, narcissistic personality disorder, you don't have any devotion. You cannot access any reverence or capacity to see the beauty or sacredness of something out there, something worthy of your service. And so you've got all this royal energy, but it's not. It is really flooding you, and you really can't sense anything beyond you that is worthy of your sacrifice. And that's really a dead end. And a lot of narcissistic personality disorders die young because they can't find anything worth living for. It's a meaning question for a narcissistic personality disorder. And so let me just finish that. So when I'm working with a narcissistic personality disorder, as soon as I can develop a kind of a therapeutic alliance, they're a very gifted person. Many of them are. I will move directly into helping them see that they, in spite of all the flooding of this royal energy, they've really not developed the king's name, because they really don't know what they're trying to do that's worthwhile. So you have to open up that whole meaning thing for a narcissist, because they can't access the meaning thing. Well, you can admire someone's creativity. You can in working on that stuff. You can use admiration, conscious admiration, as a way to boot up any of these sectors. So it's not a particular sector. You can find your saints of the different sectors and use admiration to boot that up as a self-object transference in that sector. And so, I wouldn't say to you, don't ever admire someone that has an energy that would be helpful to you simply because they were a little self-destructive. Because many people who have powerful manifestations of one of these systems are self-destructive. So I wouldn't want to be perfectionistic about who you choose to admire, but it's good to be conscious. You don't want to merge with a figure that's self-destructive. You want to admire them, not idealize them. You know, when you idealize somebody, you merge with them. There's a merger that's going on, unconscious merger. So now, I wanted to add one more thing, and then we've got a few minutes for any other question or comment. Remember what I've said, that the first stage of this process is really creating the vessel, trying to create the self-system as a vessel. And that's why so much attention has to be given to structural integrity and structural issues. But I wanted to say once again that I'm not suggesting that ends the healing process or the individuation process. It is really the beginning of analytical work and spiritual development in a new key, in another level. Because look at it this way. I'd like to talk about creating. First, you create the inner temple. That's the structural carpentry work, structural engineering. And then you've got to kind of welcome the conscious sacred into that space. And that means that's what all these different spiritual traditions are talking about when they're talking about sanctification or deification or becoming a yogi, a master yogi or something like that, is to get to be able to allow the great energies to come and dwell with you. And that's creativity. That's becoming creative and joyful, creative, generative, joyful, wise. It's what the Buddhists talk about, recognizing the Buddha nature in you and, becoming a bodhisattva. See, I'm not saying that that's arrogant. I don't think these higher reaches of spiritual development, I don't believe for a minute that they're just a fantasy of crazy people. I believe that, I know a lot of very, very developed people spiritually. And one of the things you can tell, if they have effective compassion, if they have compassion and they have the capacity to be effective in their lives, and if they have a sense of humor and can play and enjoy themselves, you've got somebody that's really being a vessel for a lot of sacred energy. And, in the Christian tradition, they talk about incarnation. And I think that you look at Ettinger's work and think about this. Really, you're really talking about, it's not that we don't want these huge divine energies in the psyche. That's not what I'm saying at all. I'm saying when they're in the psyche unconsciously, they flood and possess the human being. They don't move them forward on their evolution. Our task is to help the person create a vessel, a cup, a temple. You can think of the chalice. The chalice is an image of an adequate self-system, which then can receive all sorts of golden energy from all of these sectors, and illumination, compassion, creativity, generativity, joy. All these things are really possible, I believe. I really believe we have fantastic potential. But not if there's not a cup created. So, do you see what I'm getting at there? A twofold movement, really. Any comments or questions? We've got just a few minutes. Everybody's got a dream to return to her. Please do. So anyway, my strategy on this is I want to continue. I'll be doing another workshop in the fall at Harold Washington. It might not be of interest to you because I'm going to sort of go over the foundations, because I'm going to create a series of these things in terms of the foundations of structural analysis and integrative psychotherapy, to try to make available to people that are helping persons, clergy, or leaders in organizations like the Mankind Project and other Mankind Project, which is an organization that John works with, and organizations which have facilitators and Woman Within and things like that, which is a woman's organization like that. But anyway, I'm trying to kind of go through the ABCs of this for people that are on the front lines of therapy. So if you know of anyone who is in an addictions counselor or a person working in community mental health or social work or pastoral counseling or something, and you think they might be interested in studying this stuff, have them write to me in care of the Institute to get on a mailing list, because I'll be teaching this stuff in its clinical dimensions around the country and here in Chicago quite a good bit over the next decade, trying to teach enough people to be able to do this so that that the thing can be made available to practicing clinicians who can't afford to be analysts. Yeah, what we're doing the thing we're beginning, we're going to contact the different associations of the frontline therapists and people that want to that have the resources to study get an analytical training can study at the Institute here and do that sort of thing. But I'm concerned about the frontline therapists that are dealing with so much of the increasing dysfunction that we're facing, that is really culturally generated. And I want to help them understand that you can study this Jungian stuff without becoming so mystified and woo-woo that doesn't have any practical thing to do with your actual work with clients. So if you know anyone like that, please tell them to write me in care of the Institute to put their name on a mailing list. And I want to thank all of you for coming and giving me an opportunity to converse with you about this material, because it's a lot easier to develop it when you have a vessel of partners in the conversation. So thank you very much for coming. Appreciate it.
Thank you.
Thank you. Thank you.